YouTube के सॉफ्टवेयर नहीं देते भाई, बंद कर दे.
Volume is coming or not coming? Hello to all ladies and gentlemen who are on board. Please tell me the volume.
I hope we are audible, visible.
Voice lag हो रही है. Is volume coming or not coming? It is coming. The song was coming or not? Just 2-3 minutes. We'll wait for the other people. Please call all of your friends because this was the most awaited session on YouTube. This was all your demand. We prepared this session and we are back again with the last days the Maka. As we promised till exam, we are with you with the different sessions, and every day it would be blasting day.
Yes.
Every day is a like a birthday. Yes. Every day is a marriage day. Every day is a Swagrat day. Like that. Every day is a chanting day now.
जो आएगा वो पास हो जाएगा.
Yes.
जो सोता रह जाएगा वो होता है.
Done.
अच्छा
चलो.
आइए हटाई दो. ये गलत.
When I get older, I will be stronger.
Yes, I am getting stronger. My performance is increasing. Few years. Yes, some things are becoming weaker, but some things are becoming strong. Like
Let's.
Yes.
Voice is breaking. Everything is fine. Let me hear my voice only. It's perfect coming from a song की हो रही है, मेरी नहीं हो रही.
वो lag is because of
softwares. There are too many copyright issues, but some people are OP as Dr. Paras and Dr. Ashish. Done. With all your permission, sir.
Ignore that sound.
Ignore that sound. If all are live, so let's start with our class. No
अभी
voice.
अभी आ जाएगी भाई सब. It'll come soon. Don't worry.
So all of the people, hello, audible?
Yeah, आ रही है. Voice कैसे चलेगी? आ रही है.
It is coming.
Yeah.
All the people, welcome from all over India, from Hyderabad, from down south, from northeast, from Punjab, Jammu Kashmir, from your Gujarat, Rajasthan, everyone. Hello guys, let's start with microbiology. Northeast Manipur. कैसे बोल गया मैं Shillong?
We should remember all region partners. Kerala,
Trivandrum,
Tugamano,
Vanakkam. Perfect.
East, West, North India.
Chalo guys, let's start.
And all of you,
Yes.
please give the mock test. Those who are giving the mock test and getting even 130s, they will pass if they do the chanting session, concise class and rapid revision. Okay, tomorrow we'll finish the micro, then do pediatrics, medicine, all the important subjects. Chalo start करते हैं without delay.
Yes. So bacterial smear staining, iodine is a modern fixer. Iodine is a modern fixer. And acetone, girls, all of my friends who are female on boards, please, you remember acetone. Acetone is helpful in what? फीमेल नोज सर बेटर। एसीटोन किस काम आता है?
यस
यस, इनको पता है किस काम आता है। मिटाने के काम
हम
आता
भी
है।
कुछ यूज करते हैं।
यस, क्या यूज करते हैं? डीकोलराइजर। सो रिमेंबर एसीटो ओ ओ ओ डीकोलराइजर, डीकोलराइजर, डीकोलराइजर। सैफ्रॉन काउंटर स्टेन। तो कंट्री के झंडे के अंदर कैसा कलर है? सैफ्रन कलर। कौन सा है? सैफ्रॉन कलर है। दैट इज व्हाई रिमेंबर सैफ्रॉनिन इज अ काउंटर स्टेन। सो जस्ट वी स्टडीड अबाउट द three stains, sir. Number one is your iodine, that is your moderate fixer. Then comes your acetone, that is your decolorizer. Then comes your saffronin, that is your counter stain. That is your counter stain. This video is only available live. If anyone want to join, please tell them to join, and I promise you video would be private very soon after the class. Don't worry, ठीक है? Who will be learning now would be learning now only, later कल कुछ नहीं होने वाला, आज ही जो होगा वो होगा, सामने आमने सामने होगा, ठीक है? Guys, remember thick peptidoglycan. Thick peptidoglycan is present in gram positive, and thin peptidoglycan is present in gram negative. Gram negative is pink color, gram positive is purple to violet color. Gram positive is purple to violet color, purple to violet color, purple to violet color. Done, done. चलो, उसके बाद क्या है? Acid fast staining. Guys, remember number one type of staining we are going to learn is acid fast staining. So remember, use is Mycobacterium TB. First acid stain we are going to study, acid fast stain, is your Ziehl-Neelsen stain. It is your Ziehl-Neelsen stain. It is used for Mycobacterium TB. And how you have to remember, just by Ziehl-Neelsen stain in examination, you should be thinking of one blue color background with the purple type, pinkish type, red color crystals present over it. This stain is Ziehl-Neelsen stain. It is used for what, sir? It is used for what? Mycobacterium TB. So for Mycobacterium TB, which stain we are using, which acid fast stain we are using? So your straight away answer is Ziehl-Neelsen stain.
टीवी पे जी न्यूज देखना।
बिल्कुल, टीवी पे क्या देखना है? जी न्यूज देखना है।
जी न्यूज देखना है। निमोनिक याद कर लो, टीवी पे
जी न्यूज देखना है। Ziehl-Neelsen stain. It is your Ziehl-Neelsen stain. Ziehl-Neelsen stain. Done. Then comes your Albert stain. 100% MCQ in your PG and FMG exam, sir. Yes. Remember your Albert stain, इसमें देखने मिलेगा क्या? तुम्हारा Chinese letter pattern. And in which disease this Chinese letter pattern is seen? Your straight answer is diphtheria. It is caused by Corynebacterium diphtheria. The disease name is diphtheria, and the pattern we see is a Chinese letter pattern on Albert stain. On Albert stain. ये देखो, ये ना Chinese letter. Ni hao, fangyo. Pinion. This is like a pinion. Done. Everything is crystal clear to all of you. Please give me thumbs up if everything is clear to you. Everything is visible to all of you. Audible to all of you. Yes.
Albert CD. ABCD. CD में Albert ABCD. Then comes your bipolar stain. The third stain is bipolar stain. And remember, in bipolar stain we see safety pin appearance. We see what? Safety pin appearance. We see safety pin appearance. And remember, first use of bipolar stain is in Yersinia pestis, and disease caused by Yersinia pestis would be your plague. The Yersinia pestis will lead to a disease known as plague, and drug of choice would be your streptomycin. Drug of choice would be your streptomycin. Done. Then comes very vulgar Burkholderia. Remember, Burkholderia malai, और वहां पे क्या है? मलाई है। क्या है वहां पे? मलाई. Remember, it will lead to glanders disease. It will lead to what? Glanders disease. इसके भी अंदर कौन सी है स्टेन? हमारी बाइपोलर स्टेन, और उसके अंदर क्या देखने मिल रहा है? सेफ्टी पिन अपीयरेंस. Then comes your hemophilus दूसरी हम क्या बोलेंगे? दूसरी. जब दूसरी आती है तो क्या होती है? दर्द होती है. तो याद रखना, लीड्स टू शैंक्रोइड. इट इज अ पेनफुल कंडीशन, और इसके अंदर कैसी अपीयरेंस देखने मिलती है? स्कूल ऑफ
fish appearance. MCQ of FMG exam, school of fish appearance, school of fish appearance. Remember guys, now we all have studied just acid fast staining. Number one, acid fast stain, we studied Ziehl-Neelsen. It is used in, yes, it is used in Mycobacterium TB. Then comes your Albert stain. It is used in Corynebacterium diphtheria. It causes diphtheria. And remember which pattern is seen? Chinese latter pattern is seen. Then comes your bipolar stain. Safety pin appearance is seen. Number one disease, it is your plague caused by Yersinia pestis, and drug of choice is streptomycin. Then comes your Burkholderia malayi. Remember guys, Burkholderia malayi, it leads to Glander's disease. It leads to what? Glander's disease. So 600 are live. H दूसरी क्या है? H दूसरी आते ही क्या होता है? दूसरी आते क्या होता है? क्या होने लग जाता है? दर्द होती है। एक दूसरे से क्या होने लग जाती है? दर्द होने से लिए कैसे? लीड टू शैंक्रोइड. शैंक्रोइड आर पेनफुल. शैंक्रोइड आर द पेनफुल अल्सर, जेनाइटल अल्सर. नाउ सर वी आर गोइंग टू लर्न अबाउट द कैप्सुलेटेड ऑर्गेनिज्म. वी आर गोइंग टू लर्न अबाउट द कैप्सुलेटेड ऑर्गेनिज्म. As remember, very famous mnemonic I have made for this is PKBC. PKBC. It is your PKBC. Capsulated organism. All of the organism we are going to learn in just 2 minutes. Just 2 minutes we are going to learn. Listen to me. Capsulated organism. Number one, P से 2. P से there are 2. Pneumococcus and your Pseudomonas. Pneumococcus and your Pseudomonas. Pneumococcus and Pseudomonas. Pneumococcus and Pseudomonas would be first P. Then comes KBC. K for Klebsiella. K for Klebsiella. B for Bordetella pertussis. Bordetella pertussis will lead to whooping cough or 100-day cough. Whooping cough or 100-day cough. Whooping cough or 100-day cough. Then come Bacillus anthracis. Bacillus anthracis के अंदर कैसी appearance देखने मिलती है? Which appearance is seen in Bacillus anthracis? Can you tell me? Yes, you all are correct. Bamboo. कैसी appearance है? Bamboo tree appearance is seen in Bacillus anthracis. Remember. Then comes your Clostridium perfringens or Welchi. Clostridium welchi and perfringens will lead to MCQ, and that MCQ is your gas gangrene. So sir, in exam, if the question is coming, gas gangrene is caused by, so doctor sir, what you have to answer? Your answer is Clostridium perfringens or Welchi. Clostridium perfringens or Welchi. Then another C is Cryptococcus neoformans. Again, very important, Cryptococcus neoformans, capsulated organism. It is the most common cause of meningitis in the HIV positive patient. It is the most common cause of meningitis in the HIV positive patient. Most common cause of meningitis in the HIV positive patient. HIV positive patient. So remember guys, we just have completed the capsulated organism. We studied PKBC. P for Pneumococcus and Pseudomonas. K for Klebsiella. B for Bordetella pertussis, which leads to whooping cough or 100-day cough. Then we studied about the C. 2 C's we have studied. One is Clostridium perfringens or Welchi, which will lead to gas gangrene. Another we have studied about the Cryptococcus neoformans, which is the most common cause of HIV, which most common cause of meningitis in the HIV positive patient. Most common cause of meningitis in the HIV positive patient. Dun dana dun dana dum. Then listen to me very very carefully. Okay, the most of the most of the organism are capsulated organism are made up of polysaccharide except Bacillus anthracis. Bacillus anthracis, which itself is a capsulated organism, it is made by polypeptide. It is made by polypeptide. So remember, most of the capsules are made up of polysaccharide except Bacillus anthracis. It is made up of polypeptide. It is made up of polypeptide.
Well, lung means pneumonia.
Yes.
Lung लंग है, लंग।
लंग मतलब न्यूमोकोकस,
का मतलब ही लंग ही होता है।
बिल्कुल।
तो याद करना, क्वेलिंग
reaction is seen in pneumococcus. Quelling reaction, this is your PYQ. Quelling reaction is seen in pneumococcus, and McFadden's reaction is seen in Bacillus anthracis. Remember, McFadden, Bacillus anthracis, and Quelling, lung मतलब pneumo, क्या है? Pneumo. Guys, remember pneumococcus. So 2 questions, PYQ, MCQs. Done. Then comes, what is the function of capsule? Right now we studied about the capsulated organism with very famous mnemonic, and the name of it is KBC. It is PKBC. It is your PKBC. Okay? Then we studied all of the capsulated organism are made up of polysaccharide except Bacillus anthracis, which is made up of polypeptide. Polypeptide. Then comes function of capsule. Number 1, capsule avoid opsonization. To engulf the bacteria, we have to go through opsonization, means coating of the bacteria, coating of the antigen which is coming from the foreign body. We have to coat it. So capsule avoid opsonization, and because of that it prevents phagocytosis. तो पहले कोट लगता है, ऊपर से engulf कर लेता. That is why remember, avoid opsonization and prevent phagocytosis. Prevents phagocytosis. Now, biofilm. Remember, film देखने से क्या बढ़ती है? Attachment बढ़ती है. Biofilm helps in attachment. और फिल्म देख के जब जोड़े में प्यार बढ़ रहा होता है तो दूसरे जनों को आने की इजाजत उसमें नहीं होती. तो ऑल द कपल्स आर एडवाइज्ड टू वॉच द मूवी. हेल्प्स इन एंटीबायोटिक रेजिस्टेंस. सो रेजिस्टेंस कहां से आती है? माइक्रो ऑर्गेनिज्म से. इट इज ओनली बिकॉज ऑफ द कैप्सूल. सो कैप्सुलेटेड ऑर्गेनिज्म आर डिफिकल्ट टू ट्रीट. देयर इज अ बायोफिल्म प्रेजेंट, देयर इज अ कैप्सूल प्रेजेंट which resists the antibiotic,
कवरिंग करना
जरूरी है. कवर करोगे तो
एनाकोंडा को हम ढक दें.
बिल्कुल.
विल इट बी डेंजरस?
No, it not be dangerous anaconda. So guys, remember, if everything is clear to all of you, then give me a thumbs up so that I can start the next topic, and that is known as arrangement of flagella. Flagella helps in the motility. That means for the movement of microorganism, we are having what? Flagella. We are having what? Flagella. So 690 are live. Jai Hind, Jai Bharat सबको. बहुत बढ़िया. Arrangement of flagella, sir. Number 1, if a flagella is attached at the end, it is monotrichous. It is monotrichous. And remember, mona is VIP. Mona is VIP, so VIP is a mnemonic for monotrichous. VIP is a mnemonic for monotrichous. Remember, VI is Vibrio cholerae and P for Pseudomonas. V for Vibrio cholerae and P for Pseudomonas. Pseudomonas. That amphitrichous, it can be 2 flagellas at one end or can be 2 flagellas at 2 different ends. Doesn't matter. It is known as amphitrichous. This is known as amphitrichous. So remember, amphitrichous, the mnemonic is AC.
Yes.
तो AC आजकल गर्मी है, AC में जाने का मजा ही अलग है और AC में बजाने का भी मजा अलग है. सारे गामा पादा नी सा. तीन भी हो सकते हैं, थ्रीसम भी हो सकता है. Amphitrichous, it is AC. Alkaligens and Campylobacter jejuni. Alkaligens and Campylobacter jejuni. Campylobacter jejuni. Then comes lopho. Lopho मैंने गुच्छा. Lopho मैंने क्या? गुच्छा. If at one side there are many flagellas attached, this is known as lophotrichous, and it is seen in Spirillum menis. Done. Then comparitrichous mean all of the sides are now having one flagella. Flagella, and remember, it is known as peritrichous, and 3 organisms. This arrangement is seen. Number 1 is your Proteus. Number 2 is your Salmonella, and number 3 is your E. coli. Proteus, Salmonella, and E. coli. So repeat along with me. Arrangement of flagella. If one side flagella is there, it is known as monotrichous. This is known as monotrichous. And what was mnemonic for monotrichous? VIP, Vibrio cholerae and Pseudomonas. Then comes your 2 flagella at one side or it as a different side. So guys, remember, 2 flagella flagella is Amphitrachus. This is known as what? Amphitrachus, A and C. Alkaligens and your Campylobacter jejuni. Then comes Lopho. गुच्छा लगा एक तरफ, क्या लगा है? गुच्छा लगा है. What is your answer? Spirilla menas. Then comes your पेरीट्राइकस. चारों कोने में क्या लगा हुआ है? चारों कोनों में लगा हुआ है क्या तुम्हारा? फ्लैजिला. डिंग 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 डिंग. तीन चीजों में देखने मिलेगा, प्रोटियस, साल्मोनेला टाइफी एंड इकोलाई. प्रोटियस, साल्मोनेला टाइफी एंड इकोलाई. डन डना डन डना डन. देन कम्स मोटिलिटी. वेरी इंपॉर्टेंट थिंग इज मोटिलिटी. व्हाट इज द फंक्शन ऑफ दिस फ्लैजिलास? दिस फंक्शन ऑफ फ्लैजिला इज मोटिलिटी. दैट मींस मूवमेंट ऑफ योर ऑर्गेनिज्म. Number one, MCQ, 100% MCQ, very soon 100% MCQ, guys. Remember, number one is tumbling mortality. Tumbling is seen in Listeria. Previous year question. Listeria full name है monocytogenes. Just remember Listeria. Tumbling mortality is seen in Listeria. Darting is seen in darting. Darting का देखना, darting is seen in Vibrio cholerae. 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 It is seen in Vibrio cholerae. पहले ढक लूं भाई. Vibrio cholerae. So guys remember, swarming. Swarming is seen in Proteus. Swarming is seen in, देखो स्विमिंग करने के बाद प्रोटीन पीना होता है क्योंकि बहुत सारी एनर्जी लॉस होती है, इसीलिए स्वार्मिंग के बाद क्या? प्रोटियस. क्या है? प्रोटियस. देन कम्स योर ग्लाइडिंग. देन कम्स योर ग्लाइडिंग. माइकोप्लाज्मा. माइकोप्लाज्मा, इट इज योर ग्लाइडिंग. माइकोप्लाज्मा, इट इज योर Mycoplasma, it is your gliding. Then come twitching. T twitching. Trichomonas vaginalis. Or Trichomonas vaginalis will lead to what? Trichomonas vaginalis. It will lead to trichomonal vaginitis. And remember, what color discharge is coming from this? Green color discharge is coming. Which color discharge is coming? Green color discharge is coming. And remember, vagina के अंदर क्या लग जाएगा? 769 are live. So guys remember what? उसके अंदर क्या लग जाएगा? स्ट्रॉबेरी लग जाएगी. और अगर उससे बिना पूछे कोई स्ट्रॉबेरी तोड़ के भाग जाए तो क्या है? एंग्री लुकिंग वेजाइना. और इट इज ऑल्सो नोन एज कॉल्पाइटिस मैकुलरिस. कॉल्पाइटिस मैकुलरिस. एंड व्हाट इज द ट्रीटमेंट? व्हाट इज द ट्रीटमेंट सर? द ट्रीटमेंट इज योर मेट्रोनिडाजोल. डन डना डन डना डन. Then falling leaf like. Falling leaf like, it is your Giardia lambia. गिरा दिया तूने अलविदा मुझे जीना है तेरे सिवा. 800 are live. जोर से बोलो, I will pass, I will pass, I will pass. Dun 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 dun. Da la 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 la. Rotatory seen in Balantium gulai. Remember the bottle of Ballantines. After drinking Ballantines, you all rotate and roll. You all rotate and roll. Guys, remember Ballantines. क्या remember है? Ballantines. After Ballantines, remember. After Ballantines, you all guys rotate. You all guys rotate and corkscrew. क्या है? It is not corkscrew. It is corkscrew. Corkscrew is seen in spirochetes. It is seen in spirochetes. Along with me, let's revise. All of my friends, let's revise all the mortalities. All of the mortalities. Please, 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 please. ठीक है? चलो मेरे साथ साथ में. Tumbling is seen in, yes, tumbling is seen in Listeria. Then comes your darting. Darting is seen in Vibrio cholerae. Darting is seen in Vibrio cholerae. Swarming is seen in Proteus. Swarming is seen in Proteus. Gliding is seen in Mycoplasma. Gliding is seen in Mycoplasma. Twitching is seen in Trichomonas vaginalis. Falling leaf से क्या है? Giardia lambia. Giardia lambia. Then comes your rotatory Ballantines. Rotatory, it is your Ballantines. Then comes your corkscrew, would be your spirochetes. Corkscrew would be your spirochetes. Corkscrew would be your spirochetes. Spirochetes, spirochetes, spirochetes. Everything is clear till this. if everything is fine, all of my friends have learned very much, then I will go on the next topic, and the next topic is very important, culture medias. Very important, culture medias. Dun 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 dun. So guys, remember, everything is clear, simple. मजे आ रहे माइक्रो पढ़ के? I'll make it very simple for you guys. You guys will love this session ever in your life, because in exam the most leftover subject is micro only. It is micro only. With that view, I don't want my any of FMG friends would leave micro for their exam. That is why this Jackass class is there in front of you. Love you all. Let's learn culture media. Along with me, let's learn what, sir, your culture media. Number one is simple media. Simple media is nutrient agar, and what is a constituent of nutrient agar? It is your peptone and meat extract. Peptone and meat extract. Then comes your complex media. First one was simple media, then comes your complex media. Complex media is further divided into two. One is your solid media, another is your liquid media. So complex is divided into two, solid and liquid. Solid, it is your enriched media, and liquid, it is your enrichment media. Solid, enriched media, and liquid is enrichment media. It is enrichment media. तो दोस्तों क्या निमोनिक बनाया मैंने यहाँ पे enrichment media का? Anyone can tell me which media? Guys, remember BCl. What is the mnemonic? BCl. BC एक साथ, L उसके बाद में, BCl क्या है? BCl solid. L is what? Solid. L is very much solid. L is very much solid. Guys, remember blood agar, chocolate agar, and Loeffler serum slow. Blood agar, chocolate agar, and Loeffler serum slow. Blood agar, chocolate agar, Loeffler serum slow. Blood agar, चॉकलेट अगार, लॉफलर सीरम रोड. ये कॉम्प्लेक्स मीडिया के कौन से वाले मीडिया है? दुन कौन से वाले मीडिया है? ये है तुम्हारे फेवरेट solid media. Then comes liquid media. Then comes your liquid media. Liquid media is also known as enrichment media. Selenite F broth and alkaline peptone water. Selenite F broth and alkaline peptone water. Selenite F broth and alkaline peptone water. Dun. Then comes your selective media. Very hi-fi names are coming in our selective media. First hi-fi name is TCBS. Thiosulfate citrate bile salt agar. Thiosulfate citrate bile salt agar is number one. Then come MSA mannitol salt agar. Then comes your potassium telluride agar. So these hi-fi names are seen in selective media. These hi-fi names are seen in selective media. These hi-fi names are seen in selective media. TCBS, MSA, and potassium telluride agar. Then number fourth is your transport media. सबसे पहले मीडिया का नाम क्या है ट्रांसपोर्ट में? It is your Venkate Ramakrishna media. Venkate Ramakrishna media is for the Vibrio cholerae. Venkate Ramakrishna media, it is for the Vibrio cholerae. Then comes your Carey Blair media. Carey Blair is again for the Vibrio cholerae. So Vibrio cholerae, we are having the two medias. Number one is Venkate Ramakrishna media. Number second is Carey Blair. क्या है? Carey वे वेंकट की केयर करा. वेंकट की क्या करी? केयर करी. तो याद रखना मीडिया कौन सा है? विब्रियो. किसके लिए? विब्रियो cholerae. Then third number is Pike's media. Third number is Pike media, and remember it is for Streptococcus pyogenes. Pike media is for Streptococcus pyogenes. Pike's media for Streptococcus pyogenes. Then comes Steers and Ames media. Steers and Ames media. It is for meningococci and gonococci. So let's revise, all of my friends. Let's revise all the medias along with me. Number one media was our simple media. Simple media में क्या है? Nutrient agar consists of peptone and meat extract. Done. Then comes your complex media. Complex media is further divided into two, solid and liquid. Solid का mnemonic क्या बनाना है? BCl.
BCL.
क्या बनाया? BCL. B से ब्लड अगार, C से चॉकलेट अगार एंड L से लॉफलर सीरम स्लो. Done. Then comes your enrichment media. We studied 2 media in enrichment media. Number 1 media is your selenite F broth and number 2 is alkaline peptone water. Then I said the selective media with the very hi-fi name. First hi-fi name is TCBS. TCBS, thiosulfate citrate bile salt sucrose. Thiosulfate citrate bile salt sucrose. Then comes MSA. Then comes mannitol salt agar. Then comes your potassium telluride agar. Then comes your potassium telluride agar. Then last comes your transport media. Last comes your transport media. Remember, Venkataraman and Kerry Blair. Venkataraman and Kerry Blair, they both are for the Vibrio chloride. Then comes your Pike's media. Pike's media is for the Streptococcus pyogens. Done. Then comes tiered enemy media is for gonococci and meningococci. Done, done. Everything is clear to you? Then we study about the anaerobic media. If everything is clear to all of you, just give me thumbs up and we'll be coming to another topic, that is your anaerobic media. That is your anaerobic media. So remember, सबसे पहला मीडिया इसके अंदर आता है रॉबर्टसन कुक्ड. ओ डॉक्टर इज हेयर प्लीज. I want to welcome our ophthalmology king, Dr. Shashwat Ray sir in class. Please, with folded hands, our ophthalmology guru is here to bless you all on YouTube live microbiology concise class. Sir, अपने सेक्सी चेहरे को सबको दिखाओ ताकि इन लोगों को भी जो है आपके दीदार हो सके.
हाय, गुड इवनिंग. ये YouTube लाइव में डॉक्टर आशीष और डॉक्टर पारस सब आपको याद करवा रहे हैं या कहीं?
यस यस कहीं 700 people are live.
Oh my God. 700 people.
Yes,
इतनी तो मेरी क्लास में तो आते नहीं. कितने कभी
500 girls
मेरी क्लास में तो आते नहीं कभी. मतलब 7 लोग नहीं बैठते मेरी
आप
क्लास
सपने में आके पढ़ा जाते हो, उनको क्लास में आने की जरूरत नहीं पड़ती इसलिए.
पर इन माय क्लास 7 लोग तो आते नहीं, तो मान लो 700 आ गए.
यस सर.
But all the best, ladies and gentlemen. All the best.
सर 50 से वो आपके आते हैं 50 पर और
दिल धड़कता है मेरा आपके आ जाने से.
कौन
दिल धड़कता है सर.
सर अभी माइक्रोबायोलॉजी.
So all the best for the exams, gentlemen. I have the privilege and honor to wish you the best, and you will all do well. I'm sure you all do well. इतनी मेहनत हो रही चारों तरफ से. डॉक्टर पारस, डॉक्टर आशीष दोनों से हो रही है. मेरी शुभकामनाएं आपके साथ हैं. ऑल द बेस्ट. डू वेरी वेल. रिमेंबर, एक भी क्वेश्चन छोड़ना नहीं है.
Yes.
एक भी छोड़ना भी नहीं है. एक भी नहीं
छोड़ना, किसी को भी नहीं छोड़ना.
और वो तो इनकी विद्या है. पर अदरवाइज मेरी आपसे सिर्फ एक ही वो है. रिक्वेस्ट. There's only one request from me. And that is that you please do not change your answer the last minute. मैंने ये कई बार देखा है कि last 20 minutes आपको फ्री हो जाते हैं, so you often change your answers. Please do not do that. I have found कि first time आपके best होते हैं. It's like intuition, it's like guess, and that is how it gets from 150 to 160 to 140, 149. So that's one tip for you which I want you to share. Please do not change your last minute answers. That's all. Thank you very much.
32 sir.
Thank you very much.
100 people came only for sir.
Yes. आंखों वाले डॉक्टर से बड़ा प्यार है. अरे इश्क अखियों से लड़ाया जाता है, इसीलिए इश्क वाले डॉक्टर भी
लेकिन मेरी क्लास में आते नहीं.
आंख वाले डॉक्टर भी, आप इश्क वाले डॉक्टर भी हैं.
दूर से बैठ के देखते हैं, लेकिन मेरे क्लास में नहीं आते. कम वक्त.
आप ताजमहल जैसे हैं, आपको दूर से ही देख के अच्छा लगता है.
Right. All the best, ladies and gentlemen. Thank you very much, and all the best for you.
Thank you, sir. Thank you, sir. So we all thanks Dr. Shashwat Ray sir, who is a branded firebrand faculty of ophthalmology of NLC. फ्लावर नहीं, फायर है ये, और सबकी दिलों की धड़कन डॉन भी है ये. ठीक है. So guys, very welcome back on anaerobic media. Remember, the first anaerobic media we are going to talk about is Robertson cooked meat media. Robertson cooked meat media, and remember. Uses for the Clostridium. Now I'll make it very simple for you. If the meat pieces are pink, meat pieces are pink,
pink meat.
as pink as strawberry. Strawberry is red, I think.
वही तो कह रहा हूँ.
चलो कोई नहीं. As pink as something X Y. Okay, so Clostridium perfringens. If meat pieces become pink, that means it is for the perfringens, and perfringens will lead to what? Gas gangrene. Perfringens will lead to what? Gas gangrene. Then comes meat pieces becoming black. Black मतलब काला हो गया धूप में, टैन हो गया, क्या हो गया? टैन हो गया, टटना हो गया, नहीं टटना नहीं हो गया, टैन हो गया तो क्या है? टेटिनाई. और इसकी अपीयरेंस कैसी होती है? ड्रम स्ट्रिक अपीयरेंस. क्लॉस्ट्रीडियम टेटिनाई की कैसी अपीयरेंस है? ड्रम स्ट्रिक अपीयरेंस. कैसी है? ड्रम स्ट्रिक अपीयरेंस. डन डना डन डना डन. देन विल स्टडी अबाउट द ऑक्सीडेज पॉजिटिव ऑर्गेनिजम्स. We study about the oxidase positive organism, and the mnemonic is what? Plan to Chandigarh. Plan to Chandigarh. So Chandigarh walo, hello to all of you who are watching us from the Chandigarh. Here is one mnemonic for you guys. Oxidase positive organism. Oxidase positive organism. Guys, remember P for Pseudomonas. P for Pseudomonas. P for Pseudomonas. L for Legionella Mycadidi. क्या है? लीजियोनीला. मीका दीदी को बोल दो मियां दीदी. क्या है? मियां दीदी. मियां दीदी क्या बोले? लीजियोनीला. बहुत हो गया, अब लीजियोनीला. इट इज योर अब भाई मतलब लीजियोनीला. मियां इसने
बनाया था. लीजियोनीला कहाँ पे जाके लेगी? क्रूज में. क्रूज में, 5 स्टार होटल में
और फ्लाइट में
वहां पे मजे लेगी, सेल्फी लेगी.
बिल्कुल बिल्कुल.
और वहां निमोनिया करा.
बिल्कुल.
एसी वाला निमोनिया, वेंटिलेशन.
लीजियोनेरिस.
लीजियोनेला.
एसी में लीजियो वरना ना लीजियो. एसी में लीजियो वरना ना लीजियो. गर्मी में ना दीजियो भाई. ये लीजियो न दीजियो. डन 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 डन. लीजियोनेला मिकादिदी. लीजियोनेला मिकादिदी. एंड एरोमोनास. क्या है? एरोमोनास. एरोमोनास. देन कम नीजेरिया मेनिंजाइटिस. And CH से Campylobacter jejuni and H influenza. Very simple for all of you. Oxidase positive organism. Now they are very much simple. Remember, number 1 is Pseudomonas. L for Legionella Mycadidi. Legionella Mycadidi. Then comes your Aeromonas, Neisseria meningitis, Campylobacter jejuni, and H influenza. And your H influenza. Influenza. Now this black chart is extremely important for you guys. Extremely important as doing brush every day in the morning. As important as taking bath after the SE-X. Then comes, remember, your gram-positive bacteria. Now your gram-positive bacteria is further divided into two. One is goal cocci, one is rod-shaped lamba, that is bacilli. That is your bacilli. So let me ask you something. Guys, cocci. First we talk about the cocci. Gram-positive bacteria I'm talking about, and first I'm talking about the cocci. Yes. Cocci, remember, we are performing one test, and that is your catalase test. Very first test on cocci what we are performing is catalase test. Catalase negative would be chain shaped streptococci. Yes. And catalase positive would be गुच्छे जैसा क्या है तुम्हारा? Staphylococcus. तो cocci पे हमने कौन सा टेस्ट परफॉर्म करा? कैटलेस टेस्ट. वो दो कैटलेस या तो नेगेटिव आएगा या क्या आएगा? पॉजिटिव. इट कैन बी नेगेटिव, इट कैन बी पॉजिटिव आल्सो. सो नेगेटिव विल बी चेन शेप कोकाई, दैट इज योर स्ट्रेप्टोकोकाई. वन विल बी बंच, गुच्छा होगा पूरा, दैट विल बी स्टेफाइलोकोकाई. दैट विल बी स्टेफाइलोकोकाई. स्टेफाइलोकोकाई.
कभी भी लाइन में नहीं आती.
यस
कैट हमेशा गुच्छे में आती.
यस गुच्छे में आती है. स्टेफाइलो. यस स्टेफाइलोकोकाई. नाउ Staphylococcus, guys, remember Staphylococcus, we perform coagulase test. We perform what? Coagulase test. We perform coagulase test. One would be coagulase negative, one would be coagulase positive. So who is coagulase positive? Your FMG exam question, your Neet PG exam question would be your staph aureus. Rest catalase. Coagulase negative would be 2. Your Staphylococcus saprophyticus and Staphylococcus epidermidis. Guys, remember saprophyticus and epidermidis. It is coagulase negative. Then again, along with me, we started from the cocci. We started from the cocci. First test we performed is catalase test. First test we perform is catalase test. Catalase negative is chain shape cocci. Catalase positive, what your bunch shape, that was staphylococci. On this staphylococci, we performed a coagulase test. Coagulase positive, coagulase negative. Coagulase positive is your Staph aureus and coagulase negative would be your Saprophyticus and epidermidis. Done, done. Then comes your bacilli. Gram positive bacilli. Main Listeria, Bacillus, Corynebacteria, then Clostridium. These all are bacilli. Rest everything Streptococci and your Cephalococcus, Saprophyticus, epidermis. These are cocci. Gram positive I am talking about. Now one by one I am going to make you very much perfect in the gram positive and gram negative. Gram positive, negative, if it is done, means your job is very much easy. Chalo, let's start with a gram positive cocci. Let's start with what? Gram positive cocci. Gram positive cocci. Gram positive cocci. Remember, sir, cons mean coagulase negative staphylococcus. You remember coagulase negative staphylococcus, what I am talking about? I am talking about these two. I am talking about these two. Coagulase negative staphylococcus. So remember, Staphylococcus epidermis and Staphylococcus saprophyticus. So guys, remember, epidermis is present on the normal flora of the skin. It is present on the normal flora of the skin. Then comes your saprophyticus. It can cause UTI in young female, but MCQ is, what is the overall most common cause of UTI in the female? Yes, your answer is E. coli. Saprophyticus can be one of cause, but if someone asks you what is the most common cause, sir, your answer is E. coli. Overall most common cause of UTI in the female would be E. coli. E. coli. Done. Then comes coagulase positive staphylococcus. So guys, remember who was coagulase positive? Who was coagulase positive, and again also your catalase positive. Let me again show you. See, he is coagulase positive also and catalase positive also. I am talking about none other than Staphylococcus aureus. 1 marks guaranteed. Staphylococcus aureus. Guys, remember what is written over here. It is catalase positive and coagulase positive. So who is catalase and coagulase positive? What is your answer? Catalase and coagulase positive. Sir, your answer is Staph aureus. Your answer is Staph aureus. Now, what kind of cluster? As it is Staphylococcus means the clusters are present. What color clusters are present? Guys, remember, purple to violet grape-like clusters. As famous as grapes of Nasik. नासिक के अंगूर बहुत फेमस है, and who all are watching from Nasik, you all are very much known about the Sula Fest over there. So guys, remember, purple to violet grape like clusters are seen. And remember, culture media. Here we are using two culture media. One is nutrient agar, another thing is blood agar. Nutrient agar and blood agar. Nutrient agar is simple media and blood agar would be your blood agar would be your complex media. What a blood agar would be your complex media. Complex media. Guys, remember, nutrient agar, we are going to see golden yellow pigmentation. This is an image. On the nutrient agar, we are going to see yellow golden pigmentation. We are going to see what? Yellow golden pigmentation. On blood agar, we will see what? Beta hemolytic colony. So this is a diagnosis of Staph aureus. This is a diagnosis of Staph aureus.
Aureum means gold.
Yes.
Golden color.
Golden color.
Aureum means
yes.
That is golden.
Done. So guys, remember your best selective media. If I talk about the selective media, means high fine names I'm talking about, that is mannitol salt agar, MSA media. Mannitol salt agar. Then comes virulence factor in Staph aureus. Which is a virulence factor in the Staph aureus? Your answer is thick layer of peptidoglycan, teichoic acid clumping factor. Thick layer of peptidoglycan, teichoic acid and clumping factor. These are the virulence factor in the Staph aureus. Guys, remember, Staph aureus can cause food poisoning. And it is your exam question. It is due to contaminated milk and meat. So which is an organism responsible for causing food poisoning in the contaminated meat and contaminated milk? So what is your answer? Straight answer is your Staph aureus. Straight answer is your Staph aureus. It is your Staph aureus. Staph aureus. Done. Then disease caused by Staph aureus, 100% important. Guys, remember, number one is cellulitis. Then comes your carbuncle. Cellulitis, carbuncle, cellulitis and carbuncle. Then comes your 2 endocarditis. Staph aureus is causing 2 endocarditis. Number one endocarditis is native valve endocarditis. Number one is native valve endocarditis. Native valve endocarditis. Next is your IV drug abuser. Previous year question. IV drug abuser, if endocarditis is happening, that is because of Staph aureus. Which type of endocarditis is happening here? Right sided valve endocarditis. Guys, remember, native valve endocarditis and right sided valve endocarditis.
Question for you.
Yes.
Question is, who will cause endocarditis infective in prosthetic valve? In prosthetic valve. Question for you. Prosthetic valve. Prosthetic valve. Prosthetic.
It is there in today's chanting.
Yes.
Welcome to know.
बताओ भी बताओ. Garima is right. It is, yes, epidermidis. Very good. Epidermidis.
Chalo bhai. Guys, remember, subdural and epidural abscess also. Subdural and epidural abscess also. So disease caused by Staph aureus would be cellulitis, carbuncle, two endocarditis are there, native valve endocarditis, and in IV drug abuser there will be right sided valve endocarditis, subdural and epidural abscess. You have studied already about the subdural and epidural hematomas. Subdural, it is of what shape? Sickle shape, and that is because of injury of what? Bridging veins. Epidural hematoma is because of what? It is of what shape? Idli shape, and it is because of middle meningeal artery. It is because of middle meningeal artery. Done. So guys, let me revise again Staph aureus for you guys. Be with me, learn with me. Today we are going to learn it very quickly. Staph aureus we are going to talk about. It is catalase positive and coagulase positive. The only organism which is catalase positive and coagulase positive, your answer is Staph aureus. Then its cluster is of what color? Its cluster is of what color? Your straight answer is purple to the violet color. Purple to the violet color. Then culture media, we were using one simple agar, that was nutrient agar, and what we were seeing on the nutrient agar, golden yellow pigmentation. We were seeing what? Golden yellow pigmentation. On the blood agar, we were seeing what? Beta hemolytic colonies. Then best selective media, if I talk about, it is MSA. It is your MSA, mannitol salt agar. If I talk about the virulence factor, it would be your teichoic acid. It would be your teichoic acid, clumping factor, and your thick layer of peptidoglycan, because this is gram positive, and in gram positive there is a thick layer of peptidoglycans present. And Staph aureus can lead to food poisoning. It can lead to food poisoning due to contaminated milk and meat. Contaminated milk and meat. Then last comes the disease caused by Staph aureus. Number one is cellulitis. Number two is carbuncle. Then comes 2 endocarditis. Which one is there? Native valve endocarditis. And if I talk about the IV drug abuser, your answer is right-sided valve endocarditis. Right-sided valve endocarditis. And also one abscess is there, subdural and epidural abscess. Subdural and epidural abscess. Absent. Done. Then comes next, MRSA. What is MRSA? Methicillin resistant Staphylococcus aureus. What is the drug of choice for MRSA? Drug of choice for MRSA would be your vancomycin. And what is the side effect of vancomycin? If I ask you, your straight answer is red man syndrome. Your straight answer is red man syndrome. Is your red man syndrome. Then what is the drug of choice for VRSA? Vancomycin resistant Staph aureus. Your answer is daptomycin. Write down in your notes. Daptomycin is better answer than linezolite. Daptomycin is better answer than linezolite. So MRSA drug of choice is vancomycin. VRSA drug of choice is daptomycin. Then best method to avoid nosocomial. Nosocomial means I'm something talking about the hospital. So guys, remember best method. This is your PYQ. The best method to avoid nosocomial spread of MRSA would be your hand washing. So most of the time, if they're asking something related to the hospital, in that, remember your answer is hand washing. Your answer is hand washing. Then comes your Streptococci. As you already know that black wala table, in that black table, there was chain like catalase negative organism. Chain like catalase negative organism, that is your Streptococci. Streptococci is having different family, alpha, beta, gamma, alpha, beta, gamma, alpha, beta, gamma. Dun, 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 dun. Now, Streptococci is what? Number one is catalase negative cocci. We are talking about the gram positive cocci and it is catalase negative chain shape. कैसे है? Gram positive cocci, catalase negative chain shape. ऐसे कुछ chain. Alpha family is having two things, Streptococcus pneumoniae and Streptococcus viridans. Streptococcus pneumoniae and Streptococcus viridans. Then beta family is having group A and group B, Streptococcus pyogen and Streptococcus agalacti. Then gamma group is having Enterococcus faecalis and Fishium. Faecalis and Fishium. Along with me. Alpha family is having what? Alpha family is having what? Alpha family is having pneumonia and viridans. Beta family is having Streptococcus pyogens and agalacti. Then faecalis and Fishium. Then comes your Streptococcus pyogen. First thing we are going to study is Streptococcus pyogens. Very important. Guys, remember, at least Streptococci means it is in chain shape. Now color, violet color cocci. Which color cocci? Violet color cocci arrange in the chains. Violet color cocci arrange in the chain. And the culture media would be your CVBA. It is your crystal violet blood agar. Crystal violet blood agar would be your culture media. And what about the transport media? Again, remember from the transport media we have studied Pike's media is for Streptococcus pyogens. Pike's media is for the Streptococcus pyogens. Now coming to the disease caused by Streptococcus pyogen. Remember guys, number one is acute pharyngitis, tonsillitis, cellulitis, impetigo, Fmge exam question, honey colored crust. Honey colored crust present near the lips is impetigo. Now if someone asks you in deep that what is impetigo caused by, your straight answer is it is caused by gram positive cocci, and that is your Streptococcus pyogen. Done. Then comes your scarlet fever. Scarlet fever में क्या देखने मिलता है? Scarlet fever में what we see? We see strawberry tongue. We see what? Strawberry tongue. चलो रिवाइज करो इसको जल्दी से. Again, please revise it very quickly. Revise it very quickly, guys. चलो जल्दी से. ठीक है? चलो strawberry tongue. Done. Let me revise it for you guys. Streptococcus pyogen, it is in chain shape. Now your violet color cocci is arranged in the chain. Culture media is CVBA, crystal violet blood agar. Transport media is Pike's media, and disease number one is acute pharyngitis, tonsillitis, cellulitis, impetigo, and scarlet fever. Scarlet fever is also caused by S. Streptococcus pyogen. And in scarlet fever, what we see? We see is strawberry tongue. We see what? Strawberry tongue. ठीक है? चलो. Guys, remember GBPS. Group B, Streptococcus, also known as Streptococcus agalacti. It is also known as Streptococcus agalacti. Remember, agalacti is most common cause of neonatal meningitis in the world. So agalacti is most common cause of neonatal meningitis in the world. So my question to you guys, most common cause of neonatal meningitis in the world would be your Streptococcus agalacti, would be your Streptococcus agalacti. And remember, this is CAM test positive. This is CAM test positive. Then let me take you on another genre, that is your gamma family of the Streptococci. This is none other than your Enterococcus. Enterococcus is further divided into two. Enterococcus is further divided into two, Faecalis and Faecium. Faecalis and Faecium is present somewhere known as normal flora of the gut. It is present somewhere known as normal flora of the gut. And remember, most common cause is surgical wound contamination. Most common cause of surgical wound contamination would be your Enterococcus, would be your Enterococcus, would be your Enterococcus, would be your Enterococcus. Done. Then for this Enterococcus, drug of choice would be penicillin plus aminoglycoside, or you can alone give what? Ampicillin. Second drug of choice would be vancomycin. Now, vancomycin resistant Enterococcus, what is your drug of choice? Linezolide or daptomycin. Out of these, daptomycin would be the better choice. Daptomycin would be the better choice. So let me revise again Enterococcus for all of my friends. Faecium and Faecalis. Faecium and Faecalis, it is present in the normal flora of the gut. It is present in the normal flora of the gut. And most common surgical wound contamination is caused by Enterococci. And drug of choice for this is penicillin plus aminoglycoside, or you can go for ampicillin alone. Or you can go for what? Ampicillin alone. Then second line would be your vancomycin. Then vancomycin resistant Enterococci, you will go for what? Daptomycin or linezolide. Daptomycin or linezolide. Next comes your Streptococcus viridans. Streptococcus viridans. Guys, remember Streptococcus viridans, two are there, mutants and viridans. Chalo, we talk about the two Streptococcus viridans. These are of alpha family. That is why mutants and viridans. Guys, remember mutants मुंह में क्या है? mutants मुंह के अंदर. तो मुंह के अंदर क्या है? dental caries. Mutants Hindi word means मुंह में. तो याद रखना, it causes what? Dental caries. It causes what? Dental caries. It causes what? Dental caries. Dental caries. Then comes your viridans. Then comes your viridans. Viridans will lead to something known as subacute bacterial endocarditis and late onset prosthetic valve endocarditis. 2 MCQs. So 2 endocarditis caused by viridans. 2 were caused by your Staph aureus. Here the 2 endocarditis are, number 1 is subacute bacterial endocarditis. Number 2 is late onset prosthetic valve endocarditis, means after 1 hour, 1 year, after 1 year. So guys, remember, staph mutants will lead to dental caries. Staph viridans will lead to what? To endocarditis. Number 1 is subacute bacterial endocarditis, and number 2 is late onset prosthetic valve endocarditis. Late onset prosthetic valve endocarditis. Done. Now your previous year question, Duke's criteria is used for. भाई Duke's criteria किसके लिए use होता है? Your straight answer is endocarditis. Duke's criteria is used for endocarditis. Duke's criteria is used for what? Endocarditis. It is used for what? Endocarditis. Shaktiman.
Yeah.
Shaktiman. Shaktiman.
Remember the Duke's criteria.
Yeah.
देखो
चलो
ऐसे याद कर लो, 12 का 2, 3 का 1.
हाँ.
यानी माने क्या है? एंड माइक है भाई. 12 का 2 और 3 का 1. लिख दे पारस.
Yes.
12 पे 2, 2 और 1 पे 3. So if 12 are apart, 2 sample positive, 2 blood culture, or if 1 are 3 sample, so blood culture positive. Clear?
Done,
So
done,
12 bar,
done, done, done. Next thing I'm going to talk about Streptococcus pneumoniae. It is your Streptococcus pneumoniae. It is catalase negative. Yes, I know catalase negative Streptococcus pneumoniae. इसके अंदर capsulated organism है Streptococcus pneumoniae. और कौन सी pneumoniae? Q lung. Which reaction is seen? Q lung reaction. Which reaction? Q lung reaction. Which reaction? Q lung reaction. And remember, Streptococcus pneumoniae is biopositive. Streptococcus pneumoniae is biopositive. So remember, biopositive, B for bile solubility, I for inulin fermentation, and O for optochain sensitivity. So who is biopositive? Who is biopositive and also capsulated, also Q-lung reaction is seen, also catalase negative? Your straight away answer is what? Streptococcus pneumoniae. Your straight away answer is what? Streptococcus pneumoniae. Streptococcus pneumoniae. Streptococcus pneumoniae. Now, disease caused by Streptococcus pneumoniae would be, most common would be your pneumonia. Most common cause of pneumonia would be Streptococcus pneumoniae. Guys, remember, most common cause of community acquired pneumonia. Community acquired pneumonia, also it will lead to others. Also it will lead to other, that is your conjunctivitis, sinusitis and meningitis. Conjunctivitis, sinusitis and meningitis. And your meningitis. Dun. Mock में भी question था हमारे biopositive organism Streptococcus pneumoniae. Guys, remember, community acquired pneumonia is further divided into two. One is your typical, another is your atypical. Typical and atypical. Typical वाले का most common cause is pneumococcus pneumoniae. Typical वाले का the most common cause is pneumococcus pneumoniae. Pneumococcus pneumoniae. Pneumococcus pneumoniae. Then comes your atypical, most common cause is Mycoplasma pneumoniae. Atypical, it is Mycoplasma pneumoniae. Guys, remember, community acquired pneumonia, typical and atypical. Typical is caused by pneumococcus pneumoniae and atypical, most common cause is Mycoplasma pneumoniae. Mycoplasma pneumoniae. Then most common cause of meningitis in all age group is your pneumococcus. All age group meningitis का most common cause is your pneumococcus, except neonates. Neonates में it was your CAM positive Streptococcus agalacti. Streptococcus agalacti. Done. So guys, drug of choice for this would be community acquired pneumonia, would be your penicillin. Let me revise with this. Okay, let me revise with this for you guys. Streptococcus pneumoniae, along with me. What first thing is written over here? It is catalase negative. Capsulated organism, Q-lung reaction positive. Again, it is biopositive. Done. The disease caused by Streptococcus pneumoniae, number one is pneumonia. उसमें भी कौन सा बोला? Community acquired pneumonia, which is further divided into two, typical and atypical. Typical is caused by pneumococcus pneumoniae and atypical is caused by Mycoplasma. And drug of choice would be your penicillin. Also, guys, remember now your gram-positive cocci is done. So one part is over. Gram-positive cocci. I hope you guys are liking this class. Please give the feedback so that we can start with the next topic, that is gram-positive bacilli. I hope everything is going fine from our side. So remember, भाई मजे आ रहे कि नहीं आ रहे? माइक्रो इज इजी नाउ और नॉट, ये बता दो बस. यस, लव यू ओपी. यस ऑसम. हमने कहा था जब हम आएंगे गर्मी छा जाएगी और पहला ही सबसे खतरनाक माइक्रोबायोलॉजी.
And I think this time micro से 20 questions
और 10 क्वेश्चन दे रहे. इस क्लास में से 10 क्वेश्चन तो एटलीस्ट वी आर गिविंग यू
So if you're giving 10 today and 15 days, then you'll
pass. Every day 10 questions we're giving, 15 days a day, and you will pass. Done. Chalo. My dear friends, gram-positive bacillus, if I'm talking about, it would be your Clostridium diphtheria. Clostridium diphtheria. Clostridium diphtheria will lead to a disease known as diphtheria. And on Albert Stain, remember it will show what Chinese letter pattern. See, let me tell you one thing. The first golden rule of examination, whenever I am talking about the topic, you should be reminding of the image, and whenever I am showing you the image, you should be knowing about that image. This is the first golden rule of the preparation. Now coming the 100% question, Clostridium diphtheria. Guys, remember, Clostridium diphtheria on Albert Stain, it will show Chinese Latin pattern, that green color image you have seen in the beginning only. Now biotypes of Clostridium diphtheria. Gravis क्या है? Gravy, daisy head appears. Gravis type है. फिर intergym क्या नहीं बोलेंगे? GIM, gravis, intermedius and mites. Gravis, intermedius and mites. Gravis, you see daisy head appearance. Intermedius, you see frog egg appearance. Mites, you see what? Post egg appearance. Mites, you see what? Post egg appearance. Along with me. Gravis, daisy head appearance. Intermedius, you are going to see frog egg appearance, and mites, you are going to see post egg appearance. Done. Then comes disease caused by Corynebacterium diphtheria. The disease caused by this is your very simple, is your diphtheria. You all have heard about the diphtheria. Let me tell you something. The clinical feature of diphtheria, that would be your pseudomembrane, the grayish white membrane present inside the मुंह खोलते क्या आ जाएगी? Grayish white membrane would be there, and remember it will bleed on removal. जैसे मुंह खोला इसके अंदर क्या है? Grayish white membrane. क्या आएगी? Grayish white membrane, and it will bleed on removal. Also you will see what? Bull neck, because of lymphadenopathy. Because of what? Yes, lymphadenopathy. Because of what? Lymphadenopathy. So along with me, diseases, diphtheria. Clinical features are two. क्या है? Pseudomembrane, grayish white membrane, bleeds on removal. Number second is bull's neck is present due to lymphadenopathy. And what is a complication? What is the cause of death in the diphtheria? Very simple. It is myocarditis. Would be your myocarditis. Myocarditis. Maximum depth in the diphtheria. It is confirmed by very high-fi. It is confirmed by very high-fi media, and the name of the media is potassium telluride agar. Would be your potassium telluride agar. And what is the treatment of choice? Anti-diphtheric serum. Treatment of choice would be your anti-diphtheric serum, and initial stages you have to treat with the help of penicillin or erythromycin. Dun. Then comes your Bacillus anthracis. Second one. Second gram-positive bacilli I am going to teach you is your Bacillus anthracis. It is capsulated polypeptide. All of the capsulated organism are made up of polysaccharide except Bacillus anthrax, and Bacillus anthrax is made up of polypeptide. Of Bacillus anthrax, which reaction is seen? McFadden's reaction. Another reaction we have seen, Kullang reaction is seen in pneumococcus. McFadden's reaction is seen in Bacillus anthracis. It is seen in Bacillus anthracis. Remember, what is the appearance? Appearance is Miss Bamboo. Bacillus anthracis, remember, appearance is Miss Bamboo. M for Medusa head appearance, I for inverted ferretry appearance, and S for string of pearl appearance. And bamboo is bamboo stick appearance. Guys, remember, bamboo stick appearance is seen in. What is your answer? Bamboo stick aperiticinin. What is your answer? Bamboo stick aperiticinin is, it is in your Bacillus anthracis. It is capsulated organism where your Quilling, where your McFadden's reaction is happening. Now, two disease, very important disease caused by Bacillus anthracis. Number one is cutaneous anthrax. Number two is pulmonary anthrax. Cutaneous anthrax will lead to what? Cutaneous anthrax will lead to what? Hyde-Potter's disease. You will see a ashkar on the nape of Ned in the Hyde-Potter's disease. Another pulmonary anthrax will lead to what? It will lead to Wool-Sorter's disease. It will lead to Wool-Sorter's disease. Both of them were your previous year questions. Sir, next comes your Bacillus cereus. Bacillus cereus causes two type of diseases. One is emetic, another one is diarrheal. Emetic, guys, remember Chinese fried rice. Potent MCQ of Neet, PG and Fmge. Chinese fried rice eater was there. Food poisoning happened. Which organism is responsible? Bacillus cereus is responsible. And diarrheal content is because of contaminated meat and milk. But the main cause of food poisoning through the meat and milk product would be your Staph aureus, but also can be Bacillus cereus. But Bacillus cereus, the main question which is coming, it is your Chinese fried rice. क्या बोलते हैं इसको? चुदाव चावफान. All the Chinese, yes, it is not from my side. It is already Chaofan, Chudao Chaofan. Chudao Chaofan. नहीं वो भाई confirm नहीं. I am graduated from China. I am FMG, so I know. Chudao Chaofan. Chinese में ये देखो सारे ये देखो Chaofan. ये देखो सारे हंसने भी लगे because they guys know. They guys know this real name. भैया लग गया था. भैया मुझे Chudao Chaofan दे दो. तो वहाँ से वो फंगी आता था. फाफा क्या होता है? फाफा तो भाई फाफा ही होता है. अब क्या करें भाई, ये बात सच्ची बात है भाई. आई एम वेरी मच करेक्ट. ठीक है दोस्तों, ठीक है. Chaofan. Yes, all of you.
I also been to China.
Yes, but चुदाव चौफान नहीं खाए होंगे. सही बात है, मुंह में खा लिए होंगे वहां जाके. यस, कुछ और ही खाया, बड़ा पसंद है आपको, है ना. और guys remember culture media for Bacillus cereus would be your MyPa. क्या है? MyPa. पापा कहते थे बड़ा नाम करेगा, बेटा हमारा ऐसा काम करेगा. ला 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 रा 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 ला 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 ला. यस, देखो चुदाव चौफान का नाम सुनते कितने खुश हो गए. मुंह में लार बह गई गंदी, ऐसे अंदर बह गई लार, बह गई, कुछ और भी बह गया. दिल के अरमासू में बह गए. Guys remember ये देखो हटाओ उसको. remember ठीक है. चलो guys remember Clostridium spore forming, and Clostridium के लिए media is RCM, Robertson cooked meat media, we talked about earlier also. Clostridium perfringens, the meat pieces were turning of which color? It was of pink color. It was of what? Pink color. It was of pink color. पिंक कलर. गाइस रिमेंबर पिंक कलर. ठीक है. चलो उसके बाद गैस गैंग्रीन एंड थिक ब्रिक शेप्ड ग्राम पॉजिटिव बेसिलाई. सो क्लोस्ट्रीडियम परफरिंजिस लीड्स टू गैस गैंग्रीन, नंबर 1 MCQ, एंड इट इज ऑफ thick brick shaped gram positive bacilli. And on Robertson cooked meat media, what color meat media would become of? That is of pink color, as pink as गुलाबी आंखें, नहीं शराबी आंखें, नहीं गुलाबी आंखें जो तेरी देखी दीवाना ये दिल हो गया. संभालो मुझको मेरे यारो, संभलना मुश्किल हो गया. ला 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 मान के दिल का कहा, मैं देखो गौतम नगर चला. ला 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 जन्नत कहाँ है?
तो इंग्लिश में सुना है. आई वॉच पिंक, यू आर पिंक एंड माय.
इसका इंग्लिश में जो ट्रांसलेशन क्या है? I've seen your pink eyes, गुलाबी आंखें जो मैंने तेरी देखी, and my heart become alcoholic, शराबी ये दिल हो गया. So this is a translation of Hindi to English.
Alcohol cause dilate cardiomyopathy.
Yes. That didn't happen. चल क्लॉस्ट्रीडियम टेटिनाई, टेट कैसे होते हैं? ब्लैक ब्लैक होते हैं, तो याद रखना टेटिनाई वुड आल्सो बिकम व्हाट? ब्लैक कलर। आरसीएम कुक्ड मीट मीडिया पे क्लॉस्ट्रीडियम टेटिनाई के लिए दैट आरसीएम मीडिया वुड बिकम ऑफ व्हाट कलर? ब्लैक कलर। हम काले हैं तो क्या हुआ दिल वाले हैं, हम तेरे 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 चाहने वाले हैं, ला 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 ला।
बंदा कितना भी गोरा हो, अंदर सब काले।
दिल
अबे
बट एक कंट्री में हम गए थे वहां सब पिंक था। गाइस, आंखें तेरी कितनी हंसी, ला ला, eyes your how much wonderful they are. Guys, remember drumstick appearance. टेटनाई में क्या टन 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 क्या है? ड्रमस्टिक अपीयरेंस। कैसी अपीयरेंस है? ड्रमस्टिक अपीयरेंस। टेटनस इज व्हाट डे डिजीज? इट इज 8th day disease. It is what day disease? 8th day disease. And incubation period would be 6 to 10 days. Incubation period would be your 6 to 10 days. And sign and symptom of tetanus, lockjaw. क्या है? lockjaw. और उसके बाद ऑस्फिसियोटोनस पोस्चर, वो नंगा सा आदमी लेटा होता है ऐसे कमर चेड़ी करके, ऑस्फिसियोटोनस पोजीशन वुड बी ऑस्फिसियोटोनस पोजीशन। देन कम्स योर Clostridium botulinum. There are two types of Clostridium botulinum, sir. One is enterotoxin and other thing is neurotoxin. Enterotoxin, guys remember, entero मतलब अंदर, अंदर क्या? अंदर खाना अगर सेव करके रखोगे, लेट सपोज कैंड फूड पॉइजनिंग, इट विल लीड टू एंटीरोटॉक्सिन ऑफ क्लॉस्ट्रीडियम बोटुलिनम। बॉटल के अंदर खाना रखोगे, क्या कॉज करेगा? पॉइजनिंग कॉज करेगा। क्या कॉज करेगा? वो पॉइजनिंग कॉज करेगा। सो रिमेंबर कैंड फूड पॉइजनिंग। कौन सी है? कैंड फूड पॉइजनिंग। एंड साइन एंड सिम्टम डिस्पेजिया, डिप्लोपिया एक्सेप्ट कॉन्स्टिपेशन। देन न्यूरोटॉक्सिन, females love them and old age people also loves them. Botox treatment for the wrinkles, they block the neuromuscular junction. Because of that the skin would be stretched forever, and stretched skin is the sexiest skin and there will be no wrinkles. Also we can use in the eye surgeries. So Dr. Shashwat Ray sir also can use Botox treatment to treat your eye, to treat your eye। तुझे मेरी याद आई, पेपर आ गए, अब तुझे मेरी याद आई, क्योंकि मैं हूं चैंटिंग वाला बॉय, तुझे मेरी याद आई बेबी, मेरी याद आई। चलो उसके बाद है क्लोस्ट्रीडियम डिफिसिल। Clostridium difficile will lead to CDAD. CDAD, daddy, call me daddy, leads to CDAD. Guys, remember Clostridium difficile associated diarrhea, और इसके लिए ड्रग ऑफ चॉइस वुड बी योर ओरल वैंकोमाइसिन, वुड बी योर ओरल वैंकोमाइसिन। इफ नॉट ट्रीटेड ऑन टाइम इट विल लीड टू pseudomembranous colitis. Let me again revise for you guys, please be with me, let's learn. We were talking about the Clostridium. Clostridium is spore forming, and guys remember culture media is Robertson cooked meat media. If it is of pink color, that means I'm talking about the Clostridium perfringens, which will lead to gas gangrene. And it is of which color? Thick brick shaped gram positive bacilli. Done. Tetanus I'm talking about. The Robertson cooked meat media would be of black color. It would be of black color. It would be of black color. And remember Clostridium tetani, its appearance is drumstick appearance, and it will lead to a disease known as tetanus. It will lead to a disease known as tetanus. Tetanus is 8th day disease. Tetanus is 8th day disease, and incubation period is 6 to 10 days. Sign and symptom would be your lockjaw and osphyxiotonous posture. Done. Then comes your Clostridium botulinum. Two types are there, enterotoxin and neurotoxin. Enterotoxin will lead to, अंदर खाना रखा है तो क्या है? Canned food poisoning would lead to what? Canned food poisoning. And sign and symptom dysphagia, diplopia, double vision except constipation. Done. Then comes your neurotoxin. Neurotoxin is Botox. Girls very much know about the Botox is treatment for the wrinkles. It is treatment for the wrinkles and eye surgeries. Then comes Clostridium difficile. It will lead to CDAD, means Clostridium difficile associated diarrhea. Drug of choice would be your oral vancomycin. If it is not treated on time, Clostridium difficile associated diarrhea, if it is not treated on time, it will lead to an MCQ, that is your pseudomembranous colitis. It will lead to what? Pseudomembranous colitis. Then comes your Mycobacterium tuberculosis. I'm talking about the Mycobacterium tuberculosis. Which stain you are remembering of? It was stain was like Sir's t-shirt, blue color, and pink something crystals were there on it. Do you remember of that stain? That is your Zeal-Nielsen stain. Which stain? Zeal-Nielsen. सर ने बोला था टीवी, सर ने क्या जी न्यूज देखना, टीवी के क्या देखना है, जी न्यूज देखनी है, क्या देखनी है, जी न्यूज, ठीक है। चल, in children, guys, remember, I'll make it very simple for you. In children's, lower lobes are involved. Lower lobes are involved. So, guys, remember, Ranki gone. Ranki is gone. Ranki नीचे से चली गई. Ranki नीचे से चली गई. So, Ranki's complex and Gon's complex. Ranki's complex and Gon's complex. Gon complex is Gon's focus plus hilar lymphadenopathy. Ranki's complex is calcified hilar lymphadenopathy. तो Ranki is gone. बच्चों में lower lobes are involved. Their Ranki is gone. Ranki is gone. Ranki's complex and Gon's complex. Now post primary TB upper lobes are involved. मतलब ऊपर के lobes are involved. तो ऊपर क्या है तुम्हारा, आसमान, ऊपर क्या है, आसमान। दैट इज वाई आसमान फोकस, क्या है, आस ऊपर कर दी, आसमान फोकस। तो ऊपर क्या है, आसमान, ऊपर क्या है, आसमान, और नीचे से रैंकी गॉन। ऊपर देखता रह गया मैन बेचारा, आसमान को तारे देख रहा हूं, नीचे से रैंकी गॉन। तो लोअर लोब्स में रैंकीज कॉम्प्लेक्स, गॉन्स कॉम्प्लेक्स एंड इंफ्राक्लेविकुलर लीशन वुड बी आसमान। एंड रिमेंबर, सेकेंडरी टीवी के बाद में क्या देखने मिलता है, साइमन्स फोकस। कौन सा फोकस है, साइमन्स फोकस, साइमन्स फोकस। एंड प्राइमरी टीवी में मेनली क्या देखने मिलता है, गॉन्स फोकस। प्राइमरी टीवी मेनली गॉन्स फोकस एंड योर सेकेंडरी टीवी would be your Simon's focus. Dun 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 dun. Then comes your skin TB. Skin TB में in the derma updated latest chanting we are going to talk about it. Guys, remember skin TB most common primary lesion would be lupus vulgaris. Word vulgaris itself means most common, and second most common lesion would be scrophroderma. And GITB most common, it is ileocecal junction. GITB most common site, it is ileocecal junction. And bone TB it would be spine. Bone TB it would be your port spine. It would be your port spine. Let's talk about the diagnosis part, which is very important. Sputum examination we are doing with the help of Zeal-Nielsen staining, you know, LJ media, Zeal-Nielsen and LJ media. Then we are going for MTB PCR method. For the diagnosis of TB, we are going for MTB PCR method. This is gene expert method for the detection of rifampicin resistance. So MTB PCR method, detection of rifampicin resistance. Then comes CBNAT. CBNAT is our investigation of choice. This is used to check the MTB PCR plus multiple drug resistant detection. CBNAT is your answer. Then comes your gold standard investigation would be your quantiferon TB gold assay. Would be your quantiferon TB gold assay. Then comes your tuberculin test or Montauk's test. Tuberculin test or Montauk's test, and the treatment is BCG vaccine. Now, let me make it very simple for all of you. Let's revise this thing, what we have just studied right now. Mycobacterium, remember, it is acid-fast bacteria. It is acid-fast bacteria. Remember, in children, lower lobes are involved. Ranki gone. What was mnemonic? Ranki is gone. Ranki is complex, Gon's complex. Done. Then comes your post primary TB or upper lobes are involved. Upper ऊपर क्या है, आसमान. That is why आसमान focus. Skin TB most common primary lesion would be your lupus vulgaris. Second most common lesion would be your scrophloderma. Would be your scrophloderma. GITV, remember GITV, the most common site would be ileocecal junction. Would be your ileocecal junction. And guys, remember bone TB, it would be your port spine. What you will see, port spine. Now coming to the diagnosis part, sputum examination is done by two. Number one is Zeal-Nielsen staining. Number two is LJ media. Then comes your MTB PCR method. It is for the detection of rifampicin resistant. Then comes your investigation of choice, and that is your CBNAT. It is for the checking of multi-drug resistance detection. Then comes your quantiferon TB gold assay. Then last comes your tuberculin test or Montauk's test. And if I talk about the treatment would be your VCG vaccine. So all the gram positives are over. All the important gram positives are over. Congratulations to all of my friends who are on board right now with us. Congratulations, gram positive is clear, and I hope you guys have learned gram positive. If you're giving me thumbs up, I'm going to start the next topic, that is gram negative cocci. I'm going to start with the gram negative cocci. All of you. क्या बात है, क्या बात है, ला रा 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 रा। दोस्तों क्या बात है, मजा ही आ गया आज तो मौजी आ गई है, मौजी आ गई भैया जी, मौजी आ गई।
प्यार ही प्यार,
प्यार ही प्यार, सीबी नेट, प्यार ही प्यार हो गया, अब मैं क्या करूं,
प्यार को अंजाम दो।
उस प्यार के वास्ते चैंटिंग करा दूं इनको पास और मजे दिला दूं, ला 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 ला, लो 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 लो। अभी अभी बनाया हुआ ताजा गाना आपके समक्ष, क्योंकि हम ताजे लोग हैं, ताजगी पसंद करते हैं। ओपीस, याद ओपीस। gram negative cocci, number 1 we are going to study is meningococci. What we are going to study, sir? Meningococci. Meningococci भी कैसा है? Capsulated. और meningo, मन में क्या चलता रहता है? हमेशा L चलता रहता है, इसीलिए क्या है? लेंस शेप। meningococci कैसा है? लेंस शेप। कैसा है भैया? लेंस शेप। एंड मोस्ट इन्फेक्टिव सीरोटाइप कैसी है? ABC। क्या है? ABC। और स्प्रेड कैसा है? ड्रॉपलेट इन। कैसा है? ड्रॉपलेट इन्फेक्शन। एंड डिजीज कॉज्ड बाय meningococci would be your meningitis. So meningococci will lead to what? Meningococcal meningitis. It will lead to what, sir? Meningococcal meningitis. और साइन एंड सिम्टम में सर क्या क्या होगा? फीवर, वॉमिटिंग, नेक रिजिडिटी। सबसे इंपॉर्टेंट दोस्तों, नेक रिजिडिटी। और दोस्तों मेनिंजोकोकाई की जब बात कर रहे हैं तो कैसे ट्रीट, कैसे एग्जामिन करोगे? यू विल हेल्प विद द हेल्प ऑफ लंबर पंक्चर।
वेरी इंपॉर्टेंट।
L4, L5 in children, L3, L4 in adult, लंबर पल्चर। वहां से क्या आया? CSF। CSF की क्या करेंगे? एग्जामिनेशन। तो डायग्नोसिस में देख लो दोस्तों क्या लिखा हुआ है? CSF एग्जामिनेशन। इट वुड बी योर CSF एग्जामिनेशन। कल्चर गाइज, रिमेंबर ऑन कल्चर यू आर गोइंग टू सी दिस रेड कलर कोकाई। ये रेड कलर गोल गोल दिख रहे हैं, ठीक है? दिस इज योर मेनिंजोकोकल मेनिंजाइटिस। मेनिंजोकोकल मेनिंजाइटिस गाइज। नेक्स्ट most dreadful complication would be Waterhouse friction syndrome.
वेरी इंपॉर्टेंट।
इसके अंदर क्या होता है? तुम्हारी ब्लड सप्लाई हैम्पर होती है। सर कहाँ की ब्लड सप्लाई हैम्पर होती है? एड्रिनल ग्लैंड की। कहाँ की होती है? एड्रिनल ग्लैंड की ब्लड सप्लाई हैम्पर हो जाती है मेनिंजोकोकल मेनिंजाइटिस के अंदर। किसके अंदर क्या होता है? उसके अंदर
एडिसोनियन क्राइसिस।
एडिसोनियन क्राइसिस।
क्या दोगे उसमें?
What you will give? What is the treatment you will give?
Treatment of Addisonian crisis.
Addisonian crisis, medicine question, guys. Remember, medicine question.
तड़का आता रहेगा।
Yes, medicine will come.
Bilateral, yes.
Yes.
Process or the drug of choice of this Addisonian crisis. क्या दोगे? Steroid. कौन सा दोगे? कौन सा दोगे?
आ गया नीचे।
कौन सा वाला? कौन? Yes.
और आ गया।
IV hydrocortisone. Drug of choice IV hydrocortisone. क्या बात है?
दोस्तों उसके बाद गोनोकोकाई के देखो पर्पल कलर के छोटे छोटे गोल गोल, ठीक है? इट विल लीड टू निजीरिया गोनोरिया। इट विल लीड टू निजीरिया गोनोरिया। गोनोकोकाई इज पर्पल कलर एंड meningitis it is of red color cocci. Red color cocci. One of my friends were asking to differentiate. See, this is red color cocci and this is something pinkish purple color cocci. Pinkish purple is Neisseria gonorrhea and this is your meningitis. Meningococcal meningitis. Then gonococci, the disease caused by gonococci would be your gonorrhea. मेल में इट कॉजेस यूरेथराइटिस, मेल में इट कॉजेस यूरेथराइटिस, फीमेल में इट कॉजेस सर्विसाइटिस, मेल में इट कॉजेस यूरेथराइटिस, फीमेल में इट लीड टू सर्विसाइटिस, एंड न्यूबॉर्न, प्रीवियस ईयर क्वेश्चन, न्यूबॉर्न ऑप्थेल्मिया नियोनेट्रम, न्यूबॉर्न में गोनोकोकाई विल लीड टू ऑप्थेल्मिया नियोनेट्रम, न्यूबॉर्न में ऑप्थेल्मिया नियोनेट्रम, फीमेल में सर्विसाइटिस एंड मेल में urethritis. Then complication of gonococci would be your water can perineum, Fitz hug Curtis syndrome, obsgyne. You all have very much clear about the obsgyne. There is in right hypochondrium there are perihepatic adhesions. Whenever you are moving there is an intense pain and it is seen in chronic PID. It is seen in not acute, it is seen in chronic PID. Chronic PID में क्या देखने मिलेगा? Fit hug Curtis syndrome. And guys remember chronic PID में you will see pyosulfings or hydrosulfings. Your very much answer is hydrosulfings. This is your OBG exam question. Also violent spring appearance. क्या है? Violent spring appearance. Also cogwheel appearance. These all are the appearance we see in the chronic PID. और Fitz hug Curtis भी उसके अंदर देखने मिलता है. But यहाँ पे भी ये complication है किसकी? गोनोकोकाई की. The drug of choice would be your third generation Cephalosporins. For gonorrhea, guys remember drug of choice would be your third generation Cephalosporin. So gram negative cocci is also done. Let's talk about the gram negative bacilli. Now I'll talk about the gram negative bacilli. Another 15-20 minutes and gram negative bacilli is done. All of the bacteriology is done. All of the bacteriology is very much done. डन डना डन डना डन. ठीक है, चलो चलो दोस्तों, प्लीज रिमेंबर ई कोलाई. ई कोलाई इज द मोस्ट कॉमन कॉज ऑफ UTI in the females. So what is the most common cause of UTI in the female? It is your E. coli. E. coli is again catalase positive and oxidase positive. E. coli is catalase positive and oxidase positive. Catalase positive and oxidase positive. Catalase positive and oxidase negative. Sorry, it is oxidase negative. Then comes IMVAC. E. coli is IM positive, VIC negative. E. coli is IM positive, VIC negative. What is IM VIC? Indole, I for indole, M for methyl red, VI for Voges Prochaska, and C for citrate. Voges Prochaska and citrate. Guys, remember E. coli is IM positive, VIC negative. IM positive, VIC negative. VIC negative. ठीक है, चलो भाई. Guys, remember disease caused by E. coli. 100% MCQ. Write down 100. Take a screenshot. 100% MCQ from E. coli is coming in your exam. So my dear friends on board, please be with me. Avoid the negativity. See, let me tell you something. Even when I started doing this 1 year before, many people mocked me. Many people, this, that, FMG, intern, I don't know. I continued doing work. Now I am where I am, you all know, guys, very well. So that is why avoid the negativity, just continue your work and you would be very much successful, very soon. So guys, remember, I am VIC. I am positive, VIC negative. I am positive, VIC negative. Guys, remember, people will mock you like this. एक कल का लड़का है, छोटा लड़का है, बड़ा लड़का है, अरे छोड़ना यार, क्या पढ़ा रहा है उसको सुन लेना, छोटा पढ़ेगा क्या करेगा, मजे आ रहे हैं ना, मजे लूटो, नहीं लेने हैं तो कहीं और जाओ, क्या दिक्कत लेते हो. ठीक है, चलो दोस्तों, UTI and diarrhea. So diarrhea, what all the serotypes are there? Guys, remember EPEC. EPEC causes pediatric diarrhea. EPEC will lead to what? Pediatric diarrhea. EPEC will lead to what? Pediatric diarrhea. Pediatric diarrhea. So guys, EIEC. Even they said कि FMG है, FMGs को knowledge तो होती नहीं है, ये FMG कैसे पढ़ा रहे हैं? Guys, believe me, सब अच्छा चल रहा है, मस्त चल रहा है. Let them speak. And criticizers will always promote you. वो जब जितनी बात करेंगे उतनी ज्यादा तरक्की. तो EPEC cause pediatric diarrhea. Number one is EPEC will cause what? Pediatric diarrhea. EIEC, it resembles shigellosis and Chirini test positive. Guys, remember, resemble shigellosis and Chirini test positive. EIEC resembles shigellosis and Chirini test positive. Then comes your previous year question, ETEC. ETEC will lead to travelers diarrhea. ETEC will lead to travelers diarrhea. EHEC will lead to hemolytic uremic syndrome in the children. EHEC will lead to hemolytic uremic syndrome in the children. Hemolytic uremic syndrome in the children. EAEC, cause persistent type of diarrhea. Cause persistent type of diarrhea. So all of my friends, E. coli. E. coli. Let's recall E. coli along with me. ठीक है? पास हो जाएंगे, कोई ये सुनने की जरूरत भी नहीं है. भी मैं हूं ना तुम्हारे साथ, बात छोड़ो ना इनको. E. coli, catalase positive, oxidase negative. Catalase positive and oxidase negative. I am positive, VIC negative. Disease caused by E. coli would be number one is your UTI, number second is your diarrhea. Now, अलग-अलग strains की बात करेंगे. EPEC will lead to, yes, it causes pediatric diarrhea. EIEC resembles shigellosis and Chirini test positive. And Chirini test positive, it is Chirini test, not Chirin test. ETEC causes travelers diarrhea. ETEC causes the travelers diarrhea. EHEC will lead to hemolytic uremic syndrome in the newborn. EAEC will lead to करके diarrhea बाहर निकल गया, persistent type of diarrhea. Then comes sir your neonatal meningitis. Neonatal meningitis, most common cause of neonatal meningitis would be your E. coli. Most common cause of neonatal meningitis would be your E. coli. Would be your E. coli. E. coli. E. coli. E. coli. E. coli. Guys, remember, Klebsiella would be your Klebsiella. Newborn I'm talking about. It is your E. coli. Then coming to Klebsiella. Klebsiella would be your urease positive and capsulated. Klebsiella is urease positive and capsulated. Urease positive and capsulated. Guys, remember, Klebsiella, it is IMVIC. IMVIC. I am negative, VIC positive. I am negative, VIC positive. VIC positive. I am negative, VIC positive. I am negative, VIC positive. Guys, remember, Klebsiella, E. coli. I am positive, VIC negative. Klebsiella, I am negative, VIC positive. And it is urease positive and capsulated organism. Now, Klebsiella pneumonia will lead to typical pneumonia. Klebsiella will lead to typical pneumonia. Klebsiella oozina. Oozina will lead to atrophic rhinitis, or it is also known as oozina. Klebsiella oozina. Oozina सुना हुआ है? Klebsiella oozina. Roomy nasal cavities filled with crust. A patient will not sense the foul smell, and doctor is able to smell. This is merciful anosmia. Treatment was your sodium biborate, sodium carbonate, sodium chloride. You remember of that thing? You remember merciful anosmia? Guys, remember Klebsiella oozina. Klebsiella oozina. तो क्या बोलता है? ओ साथी रे तेरे बिना भी क्या जीना, ओ साथी रे तेरे बिना भी क्या जीना. Klebsiella oozina will lead to atrophic rhinitis. Klebsiella rhinoscleromatis. Yes, rhinoscleromatis will lead to woody nose. Rhinoscleroma, woody nose. Biopsy में क्या देखने मिलता है woody nose के? It is your exam question. Biopsy में देखने मिलता है Russell bodies and Miculi cell. Russell bodies and Miculi cell. Russell bodies and Miculi cell. Dun 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 dun. Simple. So then comes your gram-negative bacilli. I am talking about Salmonella typhi. Salmonella typhi will lead to a typhoid fever. Salmonella typhi will lead to typhoid fever, and transmission is through the fecal-oral route. How fecal-oral route is happening, you know better once you go the fields, you do something there, then from the thandi air it comes into your mouth, and then it comes into your GIT, that is feco-oral route, that is feco-oral route. So my dear friend, Salmonella typhi will lead to a disease known as typhoid fever, will lead to a disease known as typhoid liver, typhoid fever. Guys, transmission is done. Clinical feature are very important. Just listen to me. Just listen to me. Number one is step ladder pattern fever. Number one is step ladder. तो स्टेप बाय स्टेप जब तुम प्यार की राहों में आगे बढ़ते हैं, अगली चीज क्या देते हो? रोज देते हो. तो क्या बोलते हो? फूल है गुलाब का, चमेली का, न समझना, आगे मैं नहीं बोलूंगा. रोज स्पॉट्स. क्या है? रोज स्पॉट सीन. तो क्या होता है? फूल तुम्हें भेजा है खत में, फूल नहीं मेरा दिल है. इसी साइड है ना? हाँ, लेफ्ट साइड में मेरा दिल है भाई. ठीक है, मैं क्या गलती से राइट साइड ना कर लूं. ठीक है दोस्तों, तो रोज स्पॉट सीन. क्या है? रोज स्पॉट सीन. और रोज सीढ़ी कैसी है? लंबी. सीढ़ी कैसी है? बड़ी लंबी, क्योंकि लंबी लाइन लगी है मोहतरमा के पीछे. लॉन्गिट्यूडनल अल्सर. क्या है? लॉन्गिट्यूडनल अल्सर. और बेबी ने जब फूल ले लिए तो बेबी को क्या पिलाने ले गए? सूप पिलाने ले गए. तो डेट में क्या ऑर्डर करा आपने? जाके सूप करा. तो सी सूप किसका करा? मटर के दाने का सूप. किसका सूप ऑर्डर करा? मटर के दाने का. तो दोस्तों याद रखना, पी सूप डायरिया. Which diarrhea is seen? Pea soup diarrhea is seen. Salmonella typhi will lead to a disease known as typhoid fever. Transmission is fecal-oral route, and clinical features step ladder pattern fever. Rose spots are seen, and longitudinal ulcer. Longitudinal ulcer, and there is one type of diarrhea, that is pea soup diarrhea. All of you friends who are having soup right now, don't feel yuck. This is a MCQ in the quick test. Then comes your culture media. Salmonella typhi, the culture media would be a Wilson and Blair media. Wilson and Blair media. Wilson and Blair media. भाई साउथ की लैंग्वेज तो मुझे आती नहीं है. एंड गाइज हु आर फ्रॉम डाउन साउथ हु आर वाचिंग मी राइट नाउ ऑन 17th and 18th, नहीं 18th and 19th, I am having offline chanting in Trivandrum, Kerala. केरला में ऑफलाइन चैंटिंग है. इफ एनीवन वांट टू ज्वाइन कैन कम देयर. नो प्रॉब्लम, नो प्रॉब्लम. फ्री एनएलसी चैंटिंग, फ्री एनएलसी चैंटिंग. गाइज रिमेंबर, now lab culture would be your basu. Lab culture would be your basu. Guys, blood culture, B for basu, blood culture. First week में what you will do? Blood culture. Second week you will go for agglutination. Third week you will go for stool culture, and fourth you will go for urine culture. Fourth you will go for urine culture. Now drug of choice. अगर आपका कोई रिश्तेदार, now all of you would be passing after 4th of June. Any of your relative calls you कि बेटा डॉक्टर बन गए, इधर आना. ये देखना पॉट में कैसे मटर के दाने निकले बाहर. तो क्या बोलना है? यक नहीं कर सकते उनके सामने, क्योंकि आप क्या हो? डॉक्टर साहब हो. तो आपको क्या करना है? रुको, लेट मी सी, कम हियर. एक पन्ना लेके आओ, पेज लेके आओ. उसमें क्या लिखनी है? थर्ड जनरेशन सेफेलोस्पोरिन. थर्ड जनरेशन सेफेलोस्पोरिन लिख के देनी है. ये ले ट्राई. ठीक है सर, आ गए हैं पी सूप पी करके. सर पी सूप कैसा लगता है आपको? फेवरेट है ना आपका? हाँ बिल्कुल. अभी हमने पढ़ा है पी सूप डायरिया इन द साल्मोनेला टाइफी.
अच्छा, फिर राइस वाटर स्टूल किस में?
So friends, it is third generation cephalosporin, and mostly we give ceftriaxone.
Yes.
ठीक है, इसमें साल्मोनेला टाइफी की ट्रीटमेंट है थर्ड जनरेशन cephalosporin. Then
lots of students were calling for classes etc.
Yes.
So I'll just inform everyone who's watching. The classes will start online from 5th of June.
5th of June.
And offline from 20th of June. The NLC classes will start.
NLC new batch. So I just gave, NLC new batch for the December exam going students. Please remember, 5th June we are starting online alkaline live interactive classes. And from 20th of June we are starting offline class. So guys, if you want, you recommend your friends by seeing our hard work, and seniors or juniors, guys, do remember this number, NLC query number for any kind. It is your 777
000
3688
so easy. 777
Guys, this is a help number if you want any assistance related to the admission. So let's continue. Shigella, catalase, सिंड्रेला तेरे ते आया दिल मेरा मटर के दाने खा के लाया नहीं 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 शिजिला catalase negative and non-motile, catalase negative and non-motile, secrete Shiga toxin by Shigella dysentery, Shiga toxin by Shigella dysentery, Shiga toxin by Shigella dysentery. And remember, bacillary dysentery, most common cause of bacillary dysentery in India. इंडिया वाले कहीं भी जाते हैं बैठ जाते हैं, उनको जहां भी मन करता है वो वहीं बैठ जाते हैं. तो शिजिला फ्लेक्शन, और चौड़े में बैठते हैं, फ्लेक्शनरी. क्या है? शिजिला फ्लेक्शनरी. तो मोस्ट कॉमन कॉज ऑफ बैसिलरी डिसेंट्री इन इंडिया वुड बी योर शिजिला फ्लेक्शनरी. Secrete Shiga toxin by Shiga dysentery. Enrichment media would be your selenite F broth, which is your liquid media. Selenite F broth, enrichment media. Dun. Then comes your Vibrio cholerae. Guys, remember, Vibrio cholerae is your catalase positive, oxidase positive and indolase positive. All of the things are positive here. And sir, आपको चावल कैसे अच्छा लगता है? आपको
गंदी बात
भाई. देखो, हर बार ये बंदा क्या कहता है, मेरे को सॉफ्ट चीजें अच्छी लगती है, तो रोटी हार्ड होती है, तो सर को क्या अच्छा लगता है भाई? चावल अच्छे लगते हैं. इसमें कोई शक की बात नहीं है. खिचड़ी चावल अच्छे लगते हैं दोस्तों सर को. तो याद रखना, it lead to rice watery diarrhea. So Vibrio cholera will lead to what? Rice watery diarrhea. And pea soup diarrhea we see in what? Salmonella typhoid fever, in the typhoid fever. ठीक है? Non-inflammatory diarrhea also. Rice watery diarrhea and non-inflammatory diarrhea. Now, cholera toxin mimics arsenic metal poisoning. Arsenic के अंदर क्या देखने मिलती है? Aldrich mealine, garlic smell. All of the FMT concise class we have briefly given the concepts over there. Now coming to the culture media of Vibrio cholerae. Vibrio cholerae. Guys, remember, transport media would be your Venkataraman media. Venkata Ramakrishna media would be your transport media. Also, there was Kerry Blair media, but enrichment media, alkaline peptone water. Enrichment media, which is alkaline peptone water. And selective media, very selective media, answer is TCBS, thiosulfate citrate bile salt sucrose. Thiosulfate citrate bile salt sucrose. Then comes your Haemophilus dosri. So let me recall Vibrio cholerae for all of you guys. Listen to me. It is catalase positive, oxidase positive, and indolase positive. It leads to MCQ diarrhea, that is your rice watery diarrhea, and non-inflammatory diarrhea. Then cholera toxin mimics arsenic metal poisoning. Culture media, transport media is Venkatarama media, enrichment media is alkaline peptone water, which is liquid media. It is example of complex media. And then selective media would be your TCBS, thiosulfate citrate bile salt agar.
वैन में ट्रांसपोर्ट करेंगे. वैन में ट्रांसपोर्ट करेंगे. और पेप्सी रिच लोग पीते हैं. गरीब लोग तो पानी पीते हैं, जूस पीते हैं. रिच क्या हवा पीते हैं? हाँ, रिच पीते हैं, पेप्सी
चाट लेते हैं, है ना? ठीक है. हाँ, चलो
ठीक है. और सल्फेट सेलेक्ट हो गया. तो थियोसल्फेट इज सेलेक्ट, ट्रांसपोर्ट वैन में करेंगे और इनरिच करते हैं पेप्सी पीने वाले. थाईलैंड,
maybe Thai.
Selective people go to
Thailand like him.
मैं कब गया
I
है?
went there only
I
to
never
visit
went
the
there.
temples.
Yes.
I went to Thailand.
Like a leader, a
Yes,
great leader
I
went there
went
for
to
yoga.
Thailand. I went to only temples.
Yes.
There is a floating market.
Meditation.
Yes,
He did
meditation and temples only.
He met lots of goddesses.
Lots of goddesses there.
Goddesses gave all
yes,
the
blessings
their
there,
blessing.
and
Yes,
like
good.
yes, it's all like देश का नाम ऊंचा करना, ठीक है?
Yes. You've given so many souvenirs of this country to this country.
Yes. Why not?
चढ़ावा चढ़ा के आया नहीं आया?
Yes.
चढ़ावा बिल्कुल.
All for blessings, I can do
yes.
anything. Okay, just need blessing, just need blessings. So hemophilus दूसरी क्या है? Hemophilus दूसरी, तो मैंने बोला था पहले ही, दूसरी आते क्या होता है? दर्द होती है. It causes painful genital ulcer. It causes what? Painful genital ulcer. And whenever we are putting it a tissue biopsy plus staining, it shows tram track appearance or school of fish appearance. This is your PYQ. School of fish appearance, tram track appearance on tissue biopsy, and painful genital ulcers are there. For whom I'm talking about? For whom I'm talking about? Your answer is hemophilus दूसरी, also known as H दूसरी. क्या है? H दूसरी, ना तीसरी, ना ऊसरी, ना लूसरी. ये क्या है? H दूसरी. क्या है? H दूसरी. Then coming Yersinia pestis, bipolar state. Long back we studied about bipolar state. We studied about what? Bipolar state. We studied about what? Bipolar state. Bipolar state. La 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 la. पल्लू लटके, ओ मारा पल्लू लटके, ओ आया ला 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 ला, पल्लू लटके, लु 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 लु. Disease caused is plague. Causes plague, and culture media is ghee broth, and drug of choice would be streptomycin. Legionella pneumophila. Legionella pneumophila. Guys, remember, spread aerosol route from the centralized AC plant. तो legionella, अगर AC नहीं हुआ तो ना लीजियो, अगर AC हुआ तो लीजियो. तो कहा Legionella aerosol spread from the centralized. Whenever in the exam they are talking about the AC plant, they are talking about the AC, and because of AC you are getting a disease. They are only talking about the Legionella pneumophila.
Yes.
Legionella pneumophila. Guys, remember, disease is spontaneous fever and Legionnaires pneumonia. So Legionella pneumophila will lead to Legionnaires pneumonia, and the spread is through the AC plant. Spread is through the AC plant. And culture media क्या असर पता है इसका? BCY. BCY, you took in AC, you had fun there. BCY. Buffer, charcoal, yeast extract. Buffer, charcoal, yeast extract.
अब इसका ट्रीटमेंट क्या है? ये ले ऐसे क्रूज शिप पे गई थी, एसी में क्या लेगी, तो लेगी थी और उसकी फैमिली को पता लग गया, पता गाल लाल कर दिया. एरिथ्रोमाइसिन और रिफार्मसिन फैमिली को पता लग गया और लाल कर दिया एरिथ्रोमाइसिन. सही है ना? रिफार्मसिन, एरिथ्रोमाइसिन इज द ड्रग ऑफ चॉइस फॉर लीजियोनेला. तो कहां जाके लेगी ये सेल्फी? ये AC क्रूज में लेगी. Very good. Next, ninth one is Treponema palladium. Before that, let me revise for you. Legionella pneumophila. Spread is aerosol route. Spread is aerosol route from the centralized AC plant. Disease is spontaneous fever, number 1. Number 2 is Legionnaires pneumonia. Number 2 is Legionnaires pneumonia. Then comes your culture media. It is your BCY. And treatment is azithromycin plus rifampicin. Azithromycin plus rifampicin. Then comes your number 9, gram negative bacilli we are talking about. And remember, it is Treponema palladium. Disease caused by this is syphilis. Treponema palladium will lead to syphilis. Treponema palladium will lead to syphilis. Syphilis is 9 to 90 days disease. Syphilis is 9 to 90 days disease, and stages of syphilis is very important. Very important. Be with me. I'll make you learn of these 3 stages. Stage 1 is hard painless chancres. So guys, chancroid is painful. Chancres are painless genital ulcers. So syphilis के अंदर stage 1 में we are going to see what? Hard painless chancres.
we are going to see what? Hard, painless chancre. Then second stage में we are going to see the rash over the palm and sole, also condyloma lata. कॉन्डाइलोमा लैटा, हाथों में क्या आ जाएंगे? छोटे छोटे, ठीक है। एक होता है कॉन्डाइलोमा एक्यूमिनेटा, और नीचे गोभी उग जाता है ना, एक्यूमिनेटा। ये क्या? कॉन्डाइलोमा लैटा, छोटे छोटे से दाने मोती से आ जाते हैं। Rash over the palm and sole, condyloma lata lesions are also seen. Then third station would be your gumma, gumma, chuma, chuma de de, chuma, chuma de de, chuma, gumma, 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 gumma. थर्ड स्टेज क्या है? गुम्मा। सबसे पहले हार्ड, फिर रैश, फिर गुम्मा, हार्ड रैश गुम्मा, हार्ड रैश चुम्मा, हार्ड रैश गुम्मा, हार्ड रैश चुम्मा। हार्ड पेनलेस chancres are seen in first stage, rash over the palm and soles is seen in second stage, gumma skin lesions are seen in third stage. They are seen in third stage. And the diagnosis, remember, most common is by TPHA, stands for Treponema pallidum heme agglutination assay. Treponema pallidum heme agglutination assay. Then the last one is your Mycoplasma. Guys, remember, smallest bacteria. Mycoplasma क्या है? Smallest bacteria. Guys, remember, smallest bacteria would be your Mycoplasma. Cell wall is absent and cell membrane is present. Why? Because it is gram positive. It is gram positive. Culture media क्या है? Papillo. क्या है? Papillo. Papillo या Papillo. Fried egg colonies. क्या है? Fried egg colonies. Papillo agar क्या है? Papillo agar fried egg colonies. क्या है? Fried egg colonies. Mycoplasma is done. So here gram positive, gram negative, all the important microorganisms are completed.
Yes.
Congratulations to all of you. Now the basic bacteriological part is left that we will be doing in next 20 minutes.
Yes.
Did you guys enjoy the special concise class of microbiology sponsored by Next Learning Center?
Thank you,
We are very
thank you.
thankful to the management of Next Learning Center who are giving us studio,
Yes.
free access to their YouTube and everything we are doing for you guys. Dun 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 dun. I will pass. I will pass. I will
And after
pass. After
don't
passing,
forget to bring
sweets and sweethearts.
bottles. Sweetness.
स्वीट अपने स्वीट दिल के साथ वैसे वो नहीं बोला,
बिल्कुल
sweet heart
बिल्कुल
क्यों कहेंगे? come
and give us whatever you can give.
yes
And
first
जो मन
thing
में
is
आए
good
दो.
words. First thing we need is
Yes,
good
good
words of
testimonial,
to
yeah.
your juniors, to your class fellows who are like preparing, who actually need us, do refer them, show us their work, because हम काम में विश्वास रखते हैं, काम वासना के भूखे हैं, ठीक है? Bacteria and virus, guys. So with your permission, we are going to start the difference between bacteria and virus. Bacteria. Let me make it simple for you. बैक्टीरिया कैसा? बड़ा। बैक्टीरिया कैसा दोस्तों? बड़ा। बैक्टीरिया बड़ा है तो याद रखना क्या है? लार्ज। सो हु इज लार्ज? बैक्टीरिया। वायरस कैसी होती है? वी कैसी होती है? वी कैसी होती है? वी फॉर वेरी गुड. It's not V for vagina, it is V for very good. So guys, remember, as you guys are very good, virus is very small. Virus is very, very small. And all the people knows after passing, we are going go out for the grand party.
Really?
You all want to go out for the grand party for the next 19 days. You have to work day and night.
Wow.
Lamao.
क्या वहाँ सब कुछ मिलेगा?
Yes, सब मिलेगा. क्या आप ही जाओगे? सब लेने जाओगे आप?
अब जब भाई कौन छोड़ता है? इनविटेशन आए, कौन छोड़ता है?
Goa. So my dear friends, bacteria is large and the virus is small. Bacteria में both things are present. Bacteria में पहले तो बड़ा, उसके बाद क्या? Both. RNA and DNA is present. Another B in bacteria, it multiplies by बाइनरी फिशन. तो सारे के सारे बी. बैक्टीरिया बड़ा, मैंने लास्ट. बैक्टीरिया में दोनों, मतलब आरएनए प्लस डीएनए. इट मल्टीप्लाइज बाय बाइनरी फिशन. इट मल्टीप्लाइज बाय व्हाट? बाइनरी फिशन. इट मल्टीप्लाइज बाय बाइनरी फिशन. एंड दिस इज प्रो. जो बड़ा है वो क्या है? प्रो है. क्या है? प्रो. गाइस रिमेंबर, प्रोकैरियोट्स. दिस इज योर प्रोकैरियोट. दिस इज योर प्रोकैरियोट. दिस इज योर प्रोकैरियोट. देन कम्स योर वायरस. वायरस से क्या याद करा? वी से वेरी गुड, स्मॉल, या तो आरएनए या फिर डीएनए. नाउ वायरस मल्टीप्लाइज बाय इन्फेक्टिव साइकिल. Virus multiplies by infective cycle. It is neither prokaryote, it is nor eukaryote. It's neither prokaryote nor eukaryote. Who is he? Who is he? Who is he? He is virus. And who is prokaryote? Our favorite bacteria. So I hope the difference between bacteria and virus is clear to all of my friends. If it is clear, let's go to ग्राम पॉजिटिव एंड ग्राम नेगेटिव. सोचो अगर किसी का नाम गायत्री है, सोचो क्या, अगर किसी का नाम गायत्री है तो कोई उसको पूछे कि अपना फुल नेम बताओ, तो वो कैसे बताएगी? ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्. बड़ी दिक्कत, किसी का नाम गायत्री हो उसको बहुत दिक्कत है भैया. डॉक्टर ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यम धियो जो न प्रचोदयात्, भर्गो देवस्य धियो जो न प्रचोदयात्. ये क्या है? डॉक्टर, पूरा डॉक्टर ऐसा नाम बोला. बड़ा नाम,
कितना बढ़िया,
बहुत बढ़िया,
पूरा रोशन कर दो.
पूरा 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 भैया मेरे. उसके बाद क्या है? ग्राम पॉजिटिव एंड ग्राम नेगेटिव. ग्राम पॉजिटिव कैसा? मोटा. पॉजिटिव लोगों का कैसा है? मोटा है. तो याद रखना 100 लेयर्स. मेरा वो पॉजिटिव. So guys, remember 100 layers. All the Gayatris in our live chat, नमस्कार. आशीर्वाद देना, ताकि गायत्री माता किसकी माता होती है? पढ़ाई की माता होती है. गायत्री माता किसकी माता? पढ़ाई की माता. तो पढ़ाई की माता को मेरा दंडवत प्रणाम. हमारे सारे के सारे डॉक्टर्स को आशीर्वाद दो ताकि वो लाइफ में सबके सब क्या बन सके? अच्छे डॉक्टर्स बन सके. ग्राम पॉजिटिव 100 लेयर. ग्राम पॉजिटिव इट इज योर 100 लेयर एंड ग्राम नेगेटिव इट इज 1 to 2 लेयर. नेगेटिव लोग का छोटा और पॉजिटिव लोगों का बड़ा, क्योंकि इसमें ग्राम पॉजिटिव में क्या प्रेजेंट होता है? पेप्टाइडोग्लाइकैन, प्राइडोग्लाइकैन. और ग्राम नेगेटिव में क्या कम होता है? पेप्टाइडोग्लाइकैन इज लेस. तो ग्राम पॉजिटिव वालों का मोटा 100 लेयर. और याद रखना जिनका मोटा है उनसे सब चिपकना चाहते हैं तो टिकोइक एसिड इज प्रेजेंट. इट एक्ट्स लाइक अ फेविकोल. इट इज योर एग्जाम क्वेश्चन. टिकोइक एसिड इज प्रेजेंट इन ग्राम पॉजिटिव. और जो ऑलरेडी नेगेटिव लोग हैं जिनका छोटू सा है क्या? सेल मेम्ब्रेन, सेल वॉल, तो याद रखना टिकोइक एसिड इज एब्सेंट. अब जो ऑलरेडी मोटा है, क्या सर उसको आउटर मेम्ब्रेन की जरूरत है? नहीं, इसीलिए आउटर मेम्ब्रेन इज एब्सेंट. और वहां पे जो पतलू है उसको आउटर मेम्ब्रेन चाहिए कि नहीं? चाहिए. बट अगर मैं सेल वॉल की बात करूं, इट इज प्रेजेंट इन ग्राम पॉजिटिव, इट इज एब्सेंट इन ग्राम नेगेटिव. ऑल ऑफ माय फ्रेंड्स ऑन बोर्ड, प्लीज बी विद मी एंड प्लीज टेल मी व्हिच इज मोटा मोटा. मोटा मोटा कौन है? ग्राम पॉजिटिव. पत्तू पत्तू सा कौन है? ग्राम नेगेटिव. ब्लू ब्लू कौन है? ग्राम पॉजिटिव. और पिंक कलर के कौन होते हैं? ग्राम नेगेटिव. किसके अंदर थिक लेयर ऑफ पेप्टाइडोग्लाइकैन है? स्ट्रेट अवे आंसर इज ग्राम पॉजिटिव. किसके अंदर थिन लेयर ऑफ पेप्टाइडोग्लाइकैन है? स्ट्रेट अवे आंसर इज ग्राम नेगेटिव. टिकोइक एसिड इज फॉर द फेविकोल अटैचमेंट. इट एक्ट्स लाइक अ अटैचमेंट. जैसे कि गर्लफ्रेंड बॉयफ्रेंड चिपकते हैं, जैसे कि दो फूल की कलियां आपस में चिपकती है, वैसे के वैसे क्या है ये. और दो फूल की कलियां अगर आपस में चिपके तो उनको क्या बोलते हैं फॉरेंसिक मेडिसिन में? क्या बोलते? लेस्बियनिज्म. गंदी बात क्या होती है? नंबर आ रहे हैं दोस्तों. अगर वल्गैरिटी की वजह से एक नंबर आ जाता है तो क्या हमें वल्गैरिटी के पीछे जाना चाहिए? नहीं जाना चाहिए. यस, वी शुड गो. वेरी वेरी गो 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 गोवा 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 गोवा. सो गाइस रिमेंबर ग्राम पॉजिटिव 100 लेयर, ग्राम नेगेटिव is 1 to 2 layers. Outer membrane is absent in gram positive and cell membrane, cell wall is present in gram positive, and it is absent in gram negative, but outer membrane is present in gram negative. Dandana 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 done. Then comes your shape. दोस्तों shape matters. Somewhere size matters, somewhere shape matters. Both matters. Let us see who will win. So all of my friends, if one goal structure is there, it is known as cocci. And if two structures are there, it is known as diplococci. It is looking like Gandhi ji ka chashma also, and it is looking like some adipose tissue also, है ना. तो it is your diplococci, would be your diplococci. तो शेप क्या है दोस्तों? सबसे पहले एक होगा तो cocci, दो होंगे तो diplococci, चार होंगे तो tetrad, और 8 होंगे तो सारसीना. 8 होंगे तो क्या है? सारसीना. सारसीना, तेरे बिना नहीं जीना. गुच्छे वाले स्टेफाइलोकोकाई और चेन वाले स्ट्रेप्टोकोकाई. ये होते हैं कैटलेस पॉजिटिव, ये होते हैं कैटलेस नेगेटिव. फिर अगर लंबा सा है तो क्या है? बैसिलाई.
Yes.
और अगर लंबे से के आगे छोटा सा गोला लगा हुआ जैसे लगा हुआ होता है वो क्या है, कोको बैसिलाई। क्या कोको 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 बैसिलाई, क्या है, कोको बैसिलाई। देन कम्स योर टू blocks are attached with each other. This is one diplococci, or previous year question Vibrio cholerae is comma shape.
Yes.
Vibrio cholerae is comma shape. So let me revise for all of my friends on board right now, guys. सबसे पहले one ground is there, it is cocci. 2 rounds are there, this is known as diplococci. Then 4 rounds are there, this is known as tetrad. Then comes your 8 rounds are there, this is known as sarcina, and comma shape is Vibrio cholerae. Then बंच शेप इस गुच्छे जैसा क्या है तुम्हारा स्टेफाइलोकोकाई, और चेन शेप क्या है स्ट्रेप्टोकोकाई, स्ट्रेप्टोकोकाई। देन रॉड शेप इट इज बेसिलाई, एंड रॉड विद द कोको तो इट इज नोन एज कोको बेसिलाई। देन 2 boxes attached with each other would be your diplobacilli. Everything is clear to all of you? Next 100%
आ रहा है।
देखो गुरुजी की उंगली भी हिल गई,
ये स्क्रीनशॉट
आ रहा है 100% MCQ. So microbiology would be coming in the first paper. तो question number
ये देख के मैं
102. Question number would be 102. भाई मार्क कर लो 102. क्वेश्चन आने वाला है गाइस. रिमेंबर कैसे कैसे पहले लैग फेज होता है. नंबर सेकंड इज लॉग फेज. इफ पॉसिबल प्लीज ड्रॉ दीज नोट्स along with me. Please try to write somewhere also. Don't depend on the ready-made notes. Just go with your notes also. You can make better notes. Better thing. You guys are better. Guys, remember, my friends, someone is asking Veera is female or what? Veera is very much male, but he lives somewhere very secret place. I don't want to disclose here because I can only tell in the NLC online batch this thing where Veera is staying right now. We have given him some place like so guys, remember lag phase there is increase in size. So what matters? Size matters. So lag phase में क्या है? Size matter. Lag phase में क्या है? Size matter. Log phase में क्या है? Binary fission. और binary fission कौन करता है सर? बैक्टीरिया. बी से बैक्टीरिया, बी से बाइनरी फिशन. देन कम्स योर PYQ स्टेशनरी फेज. थर्ड फेज इज स्टेशनरी फेज, और इसमें क्या होती है? स्पोर फॉर्मेशन. इसमें क्या होती है? स्पोर फॉर्मेशन. नंबर फोर्थ वुड बी योर डिक्लाइन फेज. नंबर 4 would be your decline phase. C. So number 1 is lag phase where cell size is increasing. Number 2 is log phase where binary fission is taking place. Number 3 is stationary phase where spore formation is taking place, and number 4 would be your decline phase where lysis is by the endotoxin. Now let's talk about the another 100% MCQ, that is sporocidal agents. Actually after COVID this topic is very much famous now because cleanliness 100%. Again you can take a screenshot of this thing. This would be your question number 91. Take a screenshot. Both of us are guaranteed would be coming into your exam. So guys, remember sporocidal agent. Number 1 is ethylene oxide. Number 1 thing is ethylene oxide heart lung machine. क्या है? heart lung machine. जोर जोर से बोलो मेरे साथ अपनी अपनी जगह पे. Ethylene oxide is used to clean the heart lung machine. It is used to clean the heart lung machine. Then comes your formaldehyde. Formaldehyde, guys, remember OT or WARD. Formaldehyde, फॉर्मल कपड़े पहन के जाने का मन करता है जब नई नई इंटर्नशिप लगती है OT और WARD में. Formaldehyde, OT and WARD. Formaldehyde would be your OT and WARD. Glutaraldehyde क्या है? Bronchoscope, endoscope, laryngoscope. Glutaraldehyde, bronchoscope, endoscope and your laryngoscope. Guys, isopropyl alcohol. देखो अगर तुम सड़क छाप डॉक्टर को, नॉन मेडिको डॉक्टर नहीं होते,
हाँ बिल्कुल,
अगर उनके पास जाओगे तो वो क्या करते हैं, कई लोगों के तो मुंह में डालते हैं और कई लोग के यहाँ डालते हैं थर्मामीटर, है ना, आना, और उनको बेचारों को पता नहीं होता कि क्या करना है, तो वो क्या करते हैं, किसी के यहाँ डाल देते हैं, किसी के मुंह में डाल देते हैं, तो इधर सारी इन्फेक्शन कहीं नीचे डाल के डाल देते हैं, क्योंकि वो बेचारे नॉन मेडिकोस टाइप के हैं, ठीक है, तो उनको नहीं पता होता इसीलिए। बट आवर ऑल एफएमजी डॉक्टर्स दे नो वेरी वेल इसको, थर्मामीटर को अगर मुंह में डालो या नीचे डालो, उसको कहाँ पे डिबोना होता है, आइसोप्रोपाइल अल्कोहल, कहाँ पे डिबोना है, आइसोप्रोपाइल अल्कोहल। यस प्लीज, इसी के ऊपर जोक सुनाया जाए।
हमारा माइक चल रहा है क्या?
यस बिल्कुल चल रहा है।
So a very tired doctor, our FMG doctor,
यस
after 72 hours shift,
यस
okay, goes to bank to withdraw money and take out the pen to sign the withdrawal slip, but sees it is a rectal thermometer.
यस,
And now what is the reaction?
oh
Some
shit,
asshole
very
having my
very
pen right.
bad, I am pulling that, that is bad. Ethylene oxide heart lung machine would be your heart lung machine. Formaldehyde would be your OD, and what? Glutaraldehyde would be your bronchoscope, endoscope, laryngoscope. Bronchoscope, endoscope, laryngoscope. Isopropyl alcohol would be your thermometer, and phenol, Dettol and Savlon. Phenol, remember chlorhexinol. Phenol, Dettol में remember chlorhexinol, and Savlon chlorhexidine and citramide. Chlorhexidine and citramide. Dettol, it is chlorhexinol.
Yes.
Savlon chlorhexidine plus citramide. Done. So guys, remember, now we are going to talk about the next topic, that is your sterilization.
Yes, 100% questions are coming this time on
There
this
are the
topic.
100% topics. So first thing is sterilization, and in sterilization, number one thing we are going to study is your dry heat sterilization. Would be dry heat sterilization, and remember what type of damage is happening here. Dry heat sterilization, there will be a oxidative damage. What kind of damage would be there? Your answer is oxidative damage. Dry heat sterilization is having further two methods. Number one is incineration, and number two is hot air oven. Incineration and hot air oven. Incineration uses hospital waste and temperature is 1200 degrees Celsius. So incineration, it is used for the hospital waste. We are using a temperature 1200 degrees Celsius. Guys, a best method of preparation is watching the images. If possible, incineration, hot air, please watch the images also along with that. It will make a perfect memory. Incinerator, when you see, just remember it is for what? It is for hospital waste. What is the temperature? It is 1200 degrees Celsius. Then comes your hot air oven. Uses glassware, cotton swab, etc, etc. Hot air oven, which is dry heat sterilization, the temperature would be 160 degrees Celsius and the time is 2 hours. Now we just have studied that dry heat sterilization. In dry heat sterilization, we were talking about the oxidative damage. There are two types, incineration and hot air oven. Incineration and hot air oven. Incineration is for the hospital waste and the temperature is 1200 degrees Celsius. Hot air oven, remember the temperature is 160 and the timing is 2 hours. Then comes moist heat sterilization. Remember, coagulation and denaturation of the protein. Less than 100, 100 and more than 100. Less than 100, 100 and more than 100. Less than 100, we are having two. Pasteurization and inspissation. Please change the spelling. It is inspissation. It would be inspissation. 100 degree we are having boiling and tantalization. More than 100 we are having autoclave. More than 100 we are having autoclave. Now pasteurization, which is coming under the category less than 100. Less than 100 it is coming. Two methods are there, sir. Flash method and Holder method.
Yes.
Flash method means flash is coming in the seconds. So temperature is important here. That is your 72 degrees Celsius. The flash method में 72 degrees Celsius is your temperature and your timing would be 15 to 20 seconds. Timing would be 15 to 20 seconds. Holder पकड़ के रखना.
Hold her.
कितना? No, hold her नहीं है. Holder method. तो हर को पकड़ के रखना.
हर को.
नहीं, हर ने पकड़ के रखना है.
30 मिनट. आधा घंटा तो चाहिए
63 डिग्री सेल्सियस
फ्लैश फास्ट फास्ट
और कम से कम भी 30 मिनट तक पकड़ के रखा। तो ये क्या होल्ड हर मेथड, क्या है होल्ड हर मेथड, क्या है भाई होल्ड हर मेथड। गाइस रिमेंबर pasteurization of milk is under coming the under the heading of less than 100. Two types of there, first is flash method, another is holder method. Flash method 72 degrees Celsius for 15 to 20 seconds, and holder method is 63 degrees Celsius for 30 minutes. Next comes your inspissation. Next comes your inspissation. Again it is coming under the heading of 100 degrees Celsius. Temperature is important, 80 to 85 degrees Celsius. Inspissation, the temperature is 80 to 85 degrees Celsius. Timing, it is very important, 20 to 30 minutes for 3 days. 20 to 30 minutes for 3 days. 20 to 30 minutes for 3 days. Next comes tyndallization. Tyndallization and the boiling were under the degree of 100 degrees Celsius. So again your temperature would be 100 degrees Celsius, and for how long? Again 20 to 30 minutes for 3 days, same as your inspissation, 20 to 30 minutes for 3 days. Tyndallization is also 100 degrees Celsius, 20 to 30 minutes for 3 days. Next come more than 100 degree, it is your autoclave. It is your autoclave, 121 degrees Celsius for 15 minutes in 3 days. Let me summarize for all of you, then we will be going to our next chapter, that is mycology. So guys, we started from where? We started from sterilization. It is your dry heat sterilization. It is your dry heat sterilization. It will do what? Oxidative damage. It will do what? Oxidative damage. Two are there: incineration and hot air. Incineration, it is used for the hospital waste. Hot air oven, it is used for the glassware or cotton swab. Okay, so remember the temperature, it is 1200 degrees Celsius for the incineration, and for the hot air the temperature is 160 degrees Celsius for the 2 hours. Done. Then comes your moist heat sterilization. Three categories we have divided it into: less than 100, 100, more than 100. Less than 100 we are having pasteurization and inspissation. 100 degree we are having boiling and tantalization, and more than 100 we are having autoclave. More than 100 we are having autoclave. Less than 100 pasteurization. Pasteurization is further divided into two: flash method, holder method. Flash method, the temperature would be your 72 degrees Celsius and timing is 15 to 20 seconds. Then comes your holder method, 63 degrees Celsius for 30 minutes. Done. Then inspissation, less than 100, 80 to 85 degrees Celsius. It is for 20 to 30 minutes for 3 days. Then comes your tendalization, 100 degrees Celsius, 20 to 30 minutes for 3 days. Done. Then comes your last autoclave. तो क्या बोलता है? मैं निकला ऑटो लेके रास्ते पे, सड़क पे एक मोड़ आया, मैं इतने दिल छोड़ आया. Autoclave 121 degrees Celsius for 15 minutes into 3 days. So bacteriology is over. Wow. The biggest chapter of microbiology.
Bacteriology,
general and all bacteria is over in front of you. With all your permission, with all your permission, guys, allow us to start the next chapter, which is going to give you 2 to 3 MCQs. It is your mycology. The next 20 minutes we are going to complete what? Mycology. We are going to complete what? Mycology. Dun 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 dun. इसी खुशी में गाना हो जाए. इसी खुशी में मेरे दोस्तों के लिए क्या है, एक छोटू सा गाना हो जाए, फिर मैं स्टार्ट करूंगा. क्या? माइकोलॉजी, ला 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 ला. So guys,
No voice. Am I audible?
YouTube is not good. It doesn't let play copyright song.
The Ghana was Kata Laga, Hai Laga, Raja बंगले के पीछे तेरी पैरी के नीचे आहा हा
नजर में नाले के पीछे
So next chapter we are going to start. All of my friends on board with us today is your mycology.
Yes.
मेरी ऑफलाइन चैंटिंग में आवाज नहीं जाती, मेरी अपनी ऑनलाइन बैच में आवाज नहीं जाती, यूट्यूब में मेरी आवाज चली जाती है, पता नहीं क्या होता है, इतनी जोर से मैं चिल्लाता हूँ,
फीडबैक नहीं आता
है ना। हाँ, इसका डिले फीडबैक है ना, इसी वजह से चिल्लाता रहता हूँ, फीडबैक बहुत डिले इसका। सो क्लासिफिकेशन बेस्ड ऑन द लोकेशन, क्लासिफिकेशन बेस्ड ऑन द लोकेशन, क्लासिफिकेशन बेस्ड ऑन द लोकेशन। चंद्रिका जी कह रही है डांस करो, यहाँ क्या मुशायरा और मुजरा एक साथ हो रहा है क्या, पढ़ाई के साथ साथ, है ना। सर एक बार क्या हुआ, देखो मजे की बात सुनाता हूँ। मैं एक जगह गया, एक स्टूडेंट कहती सर क्या कहते हैं उसे, सर आपके मतलब बाल बहुत अच्छे लगे मुझे। मैंने कहा क्या अच्छा लगे, सर आपके बाल घुंघरू जैसे। तो मैंने कहा मोहतरमा इधर आओ। मुझे क्या, मैंने कहा इनको पहनो और नाचना शुरू कर दो।
So classification based on the location, guys. Remember.
Subcutaneous mycosis. We are going to talk about subcutaneous. कांटा लगा translate in English also.
Thorn prick. कांटा लगा, हाय लगा, आजा राजा बंगले के पीछे तेरी बैरी के नीचे आहा हा।
So what he is saying?
Thorn pricked. आहा हा हा हा। Oh my dear love, come near to my bungalow and there will be gapa gap gapa gap gapa gap. Simple translation. Yes. So subcutaneous mycosis, number one thing is mycetoma, or it is also known as madura foot. क्या बोलेंगे इसको? madura foot. So guys remember, tried is SMS.
SMS.
तो सर आपके जमाने में आप इश्क कैसे लड़ाते थे? SMS से इश्क लड़ाया करते, लड़ाते नहीं थे, पैक डलाया करते थे। SMS क्या है? SMS is a tried for mycetoma और madura foot. Subcutaneous nodule, multiple discharging sinus. हे सीरी मुझे तेरी जरूरत नहीं है। और सल्फर ग्रैन्यूल्स, subcutaneous nodule, multiple discharging sinus and sulfur granules are the features. एक और चीज मेरे को ना, मतलब ये हाईफाई डॉक्टर है, हम सब बीसी लोग हैं बिफोर क्राइस्ट, ये कहते हैं आई लव यू टू मून एंड बैक। आई लव यू फ्रॉम मून एंड बैक। इसका मतलब मैं हिंदी में ट्रांसलेट कर रहा था, आई लव यू फ्रॉम मून एंड बैक, इट इज लाइक यू आर स्टार्टिंग लविंग फ्रॉम समवन फ्रॉम द मून स्टार्टिंग एंड यू आर डूइंग गपा गप टिल बैक। मतलब शुरू से तुमने मून के आगे से प्यार करना शुरू करा और मून के पीछे तक प्यार करते हुए लेके जाओगे टू द मून एंड बैक। एंड टुडे आई वाज टेकिंग ऑफलाइन क्लास इन एनएलसी, देयर आई लर्नड वेजाइना का वो कैसा होता है, शेप कैसा होता है। इट वाज क्रीसेंट शेप, क्रिसेंट मून होता है ईद के चांस जैसा, वैसा शेप होता है। तो नाउ आई गॉट द ओरिजिनल पॉइंट। ये तो लव मून एंड बैक क्या है, ये दे आर टॉकिंग अबाउट समथिंग वेरी वेरी बैड, दे आर वेरी बैड पीपल।
टेल यू इवन वर्स,
yes,
there's a word called testimonial.
testimonial though.
So what is the origin
Is from the ancient time में if someone has to take a pledge or a swear, he or she has to hold the testes of the eldest member of the family.
Wow.
Like the eldest member of the NLC's Dr. Ashish sir. So we have to like सर की कसम, सर के सर की कसम, यहाँ पे अगर ये क्वेश्चन नहीं आया तो सर के ये सड़ जाएगा।
give your testimonial. ऐसे मुखिया जी,
मुखिया
मैं
जी।
आपके पीपी की कसम खा के कहता हूँ कि मैं testimonial
सबक्यूटेनियस माइकोसिस, माइसीटोमा और मधुरा फुट। तो ये मत्थी मत्थी कह रही है कंट्रोल, कांट कंट्रोल लाफ, लमाओ, लाफिंग आउट ऑफ एसिस। इसका मतलब ही मुझे समझ नहीं आया। कोई बंदे ने कहा सर लमाओ, मैं कहा भैया क्या कह दिया ये? उनका लाफिंग आउट ऑफ एसिस मतलब क्या, ऐसे बाहर निकल के हंस रहे हैं। तो क्या बोला, चट दिली मार दिली खेच के तमाचा, ही हंस दिली किया के पापा, ही हंस दिली। तो दोस्तों माइसीटोमा और मधुरा फुट arthritis is subcutaneous nodule, multiple discharging sinus and sulfur granule. These are of two types, actinomycetoma and eumycetoma. Actinomycetoma is having bacterial origin and they are of white granules. What we see there, white granules. Eumycetoma is having fungal origin, that is why we see what, black granules. What about the X-ray, sir? On X-ray, osteolytic lesions are seen in actinomycetoma and osteosclerotic lesions are seen in eumycetoma. Again, revise with me. Mycetoma or Madhura foot tried was subcutaneous nodule, SMS was tried, subcutaneous nodule, multiple discharging sinus and sulfur granules. These are divided into two, actinomycetoma and eumycetoma. Actinomycetoma is having bacterial origin, eumycetoma is having fungal origin. Eumycetoma is having the fungal origin and white granules are seen in actinomycetoma and black granules are seen in eumycetoma. On X-ray we are having osteolytic lesion in actinomycetoma, osteolytic in actinomycetoma, osteosclerotic in eumycetoma. So mycetoma is clear to all of my friends. Then comes your 200% MCQ, your chromoblastomycosis. यहाँ पे क्या बॉडी देखने मिलती है? कॉपर पैनी बॉडी. क्रोमोब्लास्टोमाइकोसिस 200% MCQ. टेस्टिमोनियल ले लो चाहे मेरे से, आप दिखा सकता हूँ, ठीक है? तो ये है कॉपर पैनी बॉडी. कॉपर पैनी बॉडी इज सीन इन क्रोमोब्लास्टोमाइकोसिस. इट इज सीन इन क्रोमोब्लास्टोमाइकोसिस. Then comes your sporotrichosis. Sporotrichosis, or it is also known as rose gardener's disease. It is also known as rose gardener's disease. And remember, it is caused by Sporothorax shanki. Sporotrichosis or rose gardener's disease, it is caused by Sporothorax shanki. It is caused by Sporothorax shanki, and which is dimorphic fungus. It is spread by thorn prick. Guys, it is spread by thorn. जैसे कांटा चुभता है, क्या बोलता है? कांटा लगा हाय लगा आजा राजा बंगले के पीछे. Thorn pricked me. Come my baby near my bungalow. Do. So guys, remember flower shape appearance. Flower समझी है, मैं फायर रह रही. क्या है? फायर है. फ्लावर सब्जी है, मैं फायर है. कौन सी बीमारी है ये? स्पोरोट्राइकोसिस, रोज गार्डनर्स डिसीज. स्पोरोट्राइकोसिस और रोज गार्डनर्स डिसीज. देखो फ्लावर अपीयरेंस, और इट इज आल्सो नोन एज एस्टेरॉइड बॉडी, एंड आल्सो वी सी व्हाट सिगार शेप. ये थे तुम्हारे सिगार. ये क्या है? सिगार शेप अपीयरेंस. व्हेनेवर यू आर सस्पेक्टिंग दिस काइंड ऑफ इमेज इन द एग्जाम, just remember Sporothorax shanki causing sporotrichosis, or it is also known as rose gardener's disease, and the spread is through the thorn prick. कांटा लगने से क्या होते हैं? फैलते हैं. फिर दोस्तों ये तुम्हारे जितने भी डिस्चार्जिंग साइनस होते हैं लिम्फ नोड्स के, यहाँ पे तुम्हारे क्या हो जाती है? स्कार फॉर्मेशन, और यू कैन सी वुंड्स विल अकर हियर बिकॉज ऑफ द इन्फेक्शन. बिकॉज ऑफ द इन्फेक्शन. दिस इज अ इमेज बेस्ड क्वेश्चन ऑफ गार्डनर्स डिजीज और स्पोरोट्राइकोसिस. गार्डनर्स डिजीज और स्पोरोट्राइकोसिस. ठीक है दोस्त. नेक्स्ट कम्स योर डीप माइकोसिस. सो सुपरफिशियल माइकोसिस इज क्लियर टू ऑल ऑफ यू. वी हैव स्टडीड subcutaneous mycosis. We were talking about, we have studied 3. Number 1 is mycetoma or Madhura foot. Number 2 chromoblastomycosis. Number 3 sporotrichosis or rose gardener's disease. Rose gardener's disease. Then comes your guys, remember deep mycosis. Let me make it very simple for you guys. Deep mycosis, histoplasmosis, or it is also known as darling disease. तो क्या बोलता है?
डार्लिंग आंखों से आंखें चार करने दो, आ जाओ गौतम नगर हमको भी तुम अपने से अब प्यार करने दो, डार्लिंग आंखों से आंखें चार करने दो। हिस्टोप्लाज्मोसिस, तो डार्लिंग के साथ मिलके हम क्या बनाते हैं, हिस्ट्री बनाते हैं। हिस्टोप्लाज्मोसिस गाइस रिमेंबर कॉज्ड बाय हिस्टोप्लाज्मा कैप्सुलेटम, इट इज कॉज्ड बाय हिस्टोप्लाज्मा कैप्सुलेटम, हिस्टोप्लाज्मा कैप्सुलेटम, एंड इट इज थ्रू द एरोसेल ट्रांसमिशन ऑफ द पिजन फीसिस। तो पिजन की फीसिस से तो क्या बोलता है, कबूतर आ आ आ कबूतर जा। डार्लिंग के पास चिट्ठी लेके कौन जाता है, कबूतर। हद के तो जाता है, पर डार्लिंग के पास चिट्ठी लेके कौन जाता है, कबूतर जाता है। क्या होता है, कबूतर आ कबूतर जा जा जा, पहले प्यार की पहली चिट्ठी साजन को दे, आ कबूतर आ कबूतर जा जा जा। यस पिटिकॉस, इट मिमिक्स। डार्लिंग को क्या पसंद है सर, टीवी देखना बहुत पसंद है, या टीवी देखते हुए करने में बहुत मजा आता है, तो क्या है, टीवी, मिमिक्स टीवी। सो योर डार्लिंग डिजीज हिस्टोप्लाज्मोसिस मिमिक्स विच डिजीज, टीवी। तो डार्लिंग का देखो गोल गोल है, और ये नीले नीले गोल गोल के ऊपर कांटा लगा है, तो डार्लिंग के ऊपर क्या लगे हैं, कांटे। डार्लिंग गोल गोल, डार्लिंग का गोल गोल, तो याद रखना गोल गोल के ऊपर कांटे लगे हैं। यस गाइस रिमेंबर डार्लिंग डिसीज कॉज्ड बाय हिस्टोप्लाज्मा कैप्सुलेटम, इट मिमिक्स वन डिजीज दैट इज योर टीबी, it is spreaded by pigeon feces, aerosol transmission is through the pigeon feces। चलो दोस्तों नेक्स्ट कम ब्लास्टोमाइकोसिस और नॉर्थ अमेरिकन डिजीज। तो याद रखना जैसे नॉर्थ कोरिया है ना, नॉर्थ कोरिया में बहुत ज्यादा ब्लास्ट होते हैं। नॉर्थ कोरिया में क्या होता है, बहुत ज्यादा ब्लास्ट होते हैं, बूम 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 बूम। ऐसे क्या, नॉर्थ अमेरिकन डिजीज। तो नॉर्थ से ब्लास्ट, नॉर्थ हमारे इंडिया में भी, जैसे हमारा जम्मू कश्मीर है, जम्मू कश्मीर बहुत सारे ब्लास्ट हो रहे हैं। मैं खुद जम्मू कश्मीर से हूँ, बूम 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 बूम, मैं खुद एक ब्लास्ट हूँ, है कि नहीं। कॉज बाय ब्लास्टोमाइसिस डर्मेटिडिस। क्या है, डर, और ब्लास्ट होने से क्या डर लगता है, डर्मेटिडिस। क्या है, डर्मेटिडिस। सो ब्लास्टोमाइकोसिस आल्सो नोन एज नॉर्थ अमेरिकन डिजीज एंड इट इज कॉज्ड बाय ब्लास्टोमाइसिस डर्मेटिडिस, ब्लास्टोमाइसिस डर्मेटिडिस। और इसके अंदर कैसी अपीयरेंस है, बम जैसा, देखो बम जैसा लग रहा है, फिगर ऑफ 8 अपीयरेंस, बम। ब्लू आइज हिप्नोटाइज तेरी कर दी है मैनू, बम आइज। तो गाइज रिमेंबर भाई ऐसा कुछ नहीं है, जम्मू कश्मीर सेफ नहीं है, मैं खुद वहीं पे रहता हूँ, मेरे माता पिता भी वहीं रहते हैं, ठीक है। ऐसे अफवाह फैलाने की जरूरत नहीं है, मैं खुश हूँ वहां पे रहकर, ठीक है। आपको ज्यादा शुभ चिंतक होने की जरूरत नहीं। दिस इज फिगर ऑफ 8 अपीयरेंस, दिस इज फिगर ऑफ 8 अपीयरेंस, बॉम्ब जैसा दिख रहा है। और बॉम्ब कहाँ पे, नॉर्थ अमेरिकन, दिस इज ऑल्सो नोन एज बॉम्ब अमेरिकन,
गो टू अमेरिका एंड प्लास बॉम्ब।
यस, नॉर्थ अमेरिकन डिजीज। और क्या है, डर्मेटिडिस। क्या है, डर्मेटिडिस, इट इज कॉल्ड बाय डर्मेटिडिस, इट इज कॉज्ड बाय डर्मेटिडिस। गाइस रिमेंबर इट इज कॉज्ड बाय ब्लास्टोमाइसिस, ब्लास्टोमाइसिस डर्मेट। और ब्लास्ट होने से क्या होता है, सबसे पहले क्या फटती है,
डिपेंड करता है वाटर में है या वैसे।
Look like figure of 8 appearance. Then come paracoccidomycosis और it is also known as South American disease। देखो सर, साउथ अमेरिका में क्या होता है, बहुत सारी गर्मी होती है, इसीलिए
वहां पारस जाता है, इसलिए पैरा
नहीं
पारस जाना चाहता है, पारस का सपना है, पारस का सपना है, एक दिन ब्राजील जरूर जाऊंगा, साओ पोलो जाऊंगा।
दोस्तों पैराकोकिडोमाइसिस साउथ अमेरिकन डिसीज। क्या है, साउथ अमेरिकन डिसीज। एंड गाइस रिमेंबर इट इज कॉज्ड बाय पैराकोकिडोसिस, पैराकोकिडोसिस ब्रा। तो जहां गर्मी होती है वहां सब क्या है, ब्राजील, ला 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 ला
जाएंगे,
ला 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 ला।
वहाँ क्या करेंगे?
ब्राजील देखो ना,
वहाँ तो
ब्रासिलेंसिस
coaching
क्या
होती
है?
है।
ब्रासिलेंसिस साउथ अमेरिकन डिसीज और पैराकोकिडोमाइकोसिस, इट इज कॉल्ड बाय पैराकोकिडोसिस ब्रासिलेंसिस। डर्मेटिटिस है मतलब बम फटा, कहां? नॉर्थ अमेरिकन डिसीज है। अगर तुम्हारा साउथ अमेरिकन है मतलब वहां पे क्या? ब्रासिलेंसिस। क्या है? ब्रासिलेंसिस। और दोस्तों इसमें कैसी अपीयरेंस है? मिक्की माउस अपीयरेंस और पायलट व्हील। देखो अगर इसको हटा दो, इसको हटा दो, इसको हटा दो, ये क्या बन जाएगा? मिक्की माउस। और अगर मैं इन सबको जोड़ के देखूं तो ये क्या बन जाएगा? पायलट व्हील अपीयरेंस। क्या बन जाएगी? पायलट व्हील अपीयरेंस। क्या बन जाएगा दोस्तों? ये पायलट व्हील अपीयरेंस। देन कम्स योर कैंडिडा एल्बिकेंस। देन कम्स योर कैंडिडा एल्बिकेंस। इट शोज which phenomena? Raynaud's Brody's phenomena. It shows what? Raynaud's. This is Raynaud's Brody phenomena. Guys remember, see, focus here. Raynaud's Brody's phenomena. ये क्या है? Raynaud's Brody's phenomena. This is a landmark to identify Raynaud's Brody's phenomena. This is very important landmark for the exam. This is seen in Candida albicans. This is seen in Candida albicans. Candida albicans will lead to two disease. ऊपर भी सफेद, नीचे भी सफेद। ओरल थ्रश और वैजाइनल कैंडिडियासिस। ओरल थ्रश और वैजाइनल कैंडिडियासिस। ऑन लैब डायग्नोसिस ऑन साबुराड डेक्स्ट्रोज अगार, रिमेंबर यू विल सी क्रीमी पास्चरी कॉलोनीज। यू विल सी व्हाट? क्रीमी पास्चरी कॉलोनी। क्या देखने मिला? क्रीमी पास्चरी कॉलोनी। नेक्स्ट कम्स योर क्रिप्टोकोकस न्यूफॉर्मेंस।
Yes.
Cryptococcus neoformans, remember aerosol transmission through the pigeon feces again.
Yes.
Cryptococcus से याद करना है सीपी। सर आप कनॉट प्लेस गए हो कभी?
Yes, yes.
सीपी पे आपने देखा होगा गोल गोल कलर की मार्केट और येलो येलो ऑफ वाइट कलर का उनके ऊपर, और उस वहां पे कबूतर की टट्टी बहुत होती है। तो क्रिप्टोकोकस न्यूफॉर्मन ट्रांसमिशन इज थ्रू द पिजन फीसिस एंड वो कैसा है? ऑफ वाइट सीपी मार्केट जैसा क्रिप्टोकोकस न्यूफॉर्मन। एंड दिस इज अ मोस्ट कॉमन कॉज ऑफ मेनिंजाइटिस इन द एचआईवी पॉजिटिव पेशेंट। दिस इज अ मोस्ट कॉमन कॉज ऑफ मेनिंजाइटिस इन द severe headache and
Very severe.
ठीक है?
What is the treatment of this? Let me ask it.
what is the treatment?
Hello to everyone. Parita. Hello. What is the treatment of cryptococcus? बताओ भाई। ये लिखा है भाई, ठीक है।
So guys remember, diagnosis is Indian ink staining and on saburad dextrose agar. Guys remember, drug of choice would be amphotericin B and flucytosine. Drug of choice would be amphotericin B plus flucytosine. Amphotericin B plus flucytosine. So let me revise all of the deep mycosis we have studied. Along with me, please repeat the things, would be very easy for you guys. Histoplasmosis also known as darling disease. Darling, आंखों से आंखें चार करने दो। Histoplasmosis, darling disease caused by Histoplasmosis capsulatum and transmission. कबूतर चिट्ठी लेके जाता था। Transmission is through the pigeon feces, occur mimics which TB, which disease? TB. Then come blastomycosis. It is North American disease. It is caused by blastomyces dermatitis. Blast होने से क्या था? डर लगता है। और कैसी appearance है? Figure of 8. So figure of 8 appearance is seen as blastomycosis or North American disease. Then comes to your paracoccidomycosis or South American disease. It is caused by paracoccidiosis ब्रासिलेंसिस। पैराकोकिडियोसिस ब्रासिलेंसिस। और यहाँ पे जो अपीयरेंस है मिकी माउस अपीयरेंस और पायलट व्हील अपीयरेंस। मिकी माउस अपीयरेंस और पायलट व्हील अपीयरेंस। देन कम्स योर कैंडिडा एल्बिकेंस। इट शोज रेनॉल्ड्स ब्रॉडीज फिनोमिना। दैट डिजीज इज ओरल थ्रश एंड vaginal candidiasis on SD agar. Remember क्या देखने वाले? पास्ट्री कॉलोनीज। ओरल थ्रश ट्रीटमेंट इज फ्लूसाइटोसाइड। क्या है? फ्लूसाइटोसाइड। एंड रिमेंबर क्रिप्टोकोकस न्यूफॉर्मन सीपी मार्केट। वी वर टॉकिंग अबाउट द सीपी मार्केट। एरोसोल ट्रांसमिशन थ्रू द पिजन फीसिस। मोस्ट कॉमन कॉज ऑफ meningitis in the HIV positive patient would be your cryptococcus neoformans. Diagnosis would be Indian ink staining on the Sabourash dextrose agar, and drug of choice would be amphotericin B plus flucytoside. It is your fluconazole यार। oral thrush का treatment is fluconazole, would be your fluconazole. Please correct it. Now we'll turn the superficial mycosis. The last thing we are going to study today is superficial mycosis. Superficial mycosis. Number one is tinea versicolor. Number one is tinea versicolor. Guys, remember scales are present on the tongue.
ये सही तो लिखा है ना ये। अच्छा इसका क्या?
यहाँ पे fluconazole.
आइट्रोकोनाजोल, क्लोट्रिमाजोल भी दे सकते हैं।
But orally we have to
अगर
give.
orally देंगे
Orally
तो
तो
Itra या fluconazole।
Fluconazole is better answer than itraconazole. So guys, remember your superficial mycosis. Superficial mycosis, tinea versicolor. Scales are present on the trunk and it is caused by Malassezia furfur. Malassezia furfur. Malassezia furfur will lead to tinea versicolor. It will lead to tinea versicolor. Lab diagnosis, if I talk about scales, if we take the scales and if it mix with the 10% KOH mount, remember we see what? Spaghetti and meatball appears. All of the FMGs from the China, you all have eaten spaghetti and meatball. So guys, remember spaghetti and meatball is seen in tinea versicolor, which is caused by Malassezia furfur and scale plus Wood's lamp. You will see apple green, golden yellow, sorry, scales plus Wood's lamp examination, it would be your golden yellow fluorescence. It will be your golden yellow fluorescence. Would be your golden yellow fluorescence. Then what is a treatment? Treatment would be your selenium sulfide. Treatment would be your selenium sulfide. Dandana dandana dan. Then comes your pedra. Then comes your pedra. Jung ho jati sir mein, that is pedra. So guys, pedra is black pedra and white pedra. Black pedra and white pedra. Black pedra and white pedra. So guys, remember black pedra is by Pedra hoti. So hoti black. Hi. Black pedra is by Pedra hoti. Black pedra is by Pedra hoti. और white pedra. व्हाइट पीड्रा से मैं तुम्हें एक याद कराता हूँ। व्हाइट पीड्रा तो एक तुमने गाना सुना है, बाबूजी जरा धीरे चलो, बिजली गिरी जरा बिजली गिरी, अरे इस पे गिरी उस पे गिरी किस किस पे गिरी, बाबूजी वॉक स्लोली, देयर इज अ लाइटनिंग हु इज फॉलिंग डाउन, maybe it is on him, maybe it is on him, maybe it is on her. So this is a translation of this song. Guys, remember white pedra, it is by Trichosporon bijli. तो जब बिजली बाबूजी की खटिया पे चढ़ी, धोती पहने थे और बाबूजी का व्हाइट कलर का बाहर निकल गया फ्लूइड, that is white pedra by Trichosporon bijli. Black pedra is by the Pedra hoti. Pedra hoti. Then guys, occupational disease. Then comes your occupational disease. इसमें क्या देखने मिलता है? फार्मर लंग. क्या है? farmer lung. It is due to the hay dust. It is due to the hay dust. And which type of hypersensitivity it is? It is your type 3 hypersensitivity. So occupational disease mein we are studying farmer's lung. It is due to the hay dust. And which type of hypersensitivity is there? Type 3 hypersensitivity. So thank you all. Today's concise class part 1 is done. We are now, I'm congratulating you guys that we are even taking less than 6 hours to complete all the 45 pages of the microbiology. We have revised it. I think I have spoken almost 10 times.
Everything.
10 times. So guys, this is all. We are again back firmly standing with you guys till your exam. We all want you to pass. Just keep on chanting, I will pass, 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 I will pass. अब की बार 200 पार, अब की बार 200 पार. So for any queries related to the any NLC batch, please remember this number. Guys, remember this number. NLC query would be your 777-3686. And also I am coming to Trivandrum for 2 days chanting, offline chanting. You guys can attend also. And any query, please contact on this number only for the queries. And please remember here our Instagram, do follow Dr. Ashish and me on Instagram. Guys, remember, because there I reply the maximum. Okay, there I interact maximum. It is P Jamwal 7. Dr. Ashish. Next.
If you want to do some personal talk, don't talk to me on Insta because Paras can see all my messages there. Okay?
Oh my God.
तो अगर कुछ ऐसा पर्सनल बात करनी है, क्या सर ऐसा कुछ इलाज है कुछ, तो उसके लिए अलग से ऐसे प्लीज कर,
ठीक है, चलो. So guys, remember your NLC query number, my Instagram, sir's Instagram. Do follow us if you like our work. We love you all. We love you all to no, not moon and back. नहीं, I love you all from my heart. Yeah, ठीक है, well, moon and back. ठीक है. So tomorrow also we are coming back with another energetic session, and tomorrow we are going to start with the virology. Another biggest topic tomorrow we are taking virology, parasitology, and then your general microbiology and immunology is also included. Very best notes of immunology is included in this, guys. Thank you all of you for watching us. Do refer this video to your friends also, as we maximally want to benefit all the FMGs, IMGs who all are watching us. So please stay connected to us. Love you all. Jai Hind, Jai Bharat. Good night. I request team to please switch off this streaming.